So good morning to all of you, and to begin with, a happy Doctor's Day to all of you. Happy Doctor's Day to all of you. Good morning. So today we'll finish everything, starting with lower limb. Okay, we'll start now. Just have a look. Starting with the lower limb. Okay, here we start. Now, these are the lumbar vertebrae. Have a look, understand all these things. Don't draw anything. Now that we have done everything, you'll get an overall orientation. You've gone through the previous notes. Just try to correlate. It would be very easy now to understand the lower limb. Plus, I'll give you an entire correlation of whatever we've done till now. So these are the lumbar vertebrae. Starting here. These are the lumbar vertebrae. This is the body of S1. Body of S1. Yes, and what is the body of S1 known as? The sacral promontory. Sacral promontory. The body of S1 is sacral promontory. That's the sacrum. These are the pelvic sacral foramen. Pelvic sacral foramen. And you know what would come out from here? What would come out from here? These are the pelvic sacral foramen, and what would come out from here? These are the guess what would come out from this pelvic sacral foramen? Not the sacral plexus. No, not the sacral plexus. These would be the ventral rami of the sacral spinal nerves. Ventral rami of the sacral spinal nerves will be coming out through this pelvic sacral foramen. Okay, just wait. Now tell me, what is this here? This is the ala of the sacrum. Remembering this, ala of the sacrum. And you remember the relations of the ala of sacrum that we had discussed? S-L-I-O. S was sympathetic chain. L is lumbosacral trunk. I is the iliolumbar artery. And O is the obturator nerve. Yes, sympathetic chain, lumbosacral trunk, iliolumbar artery, obturator nerve. Now we'll be coming to this. You'll be understanding this. Okay, something similar to that I told you. Relation of something which was very similar. Remember SVAN, SVAN. This was the relation of the neck of the first rib, the sympathetic chain, the first posterior intercostal vein, the superior intercostal artery, and the first thoracic nerve. Okay, so that was SVAN. Fine, so this is the ala of the sacrum. And what was this, you remember? What was this L4, L5? This L4, L5 was known as the lumbosacral trunk, remembering this? And this lumbosacral trunk enters the pelvis, joins with the ventral rami of S1 to S5. And what is this going to form? The sacral plexus. This I told you when we had discussed in the abdomen, the lumbar plexus. So L4, the ventral ramus of L4 bifurcates, divides into two. L4 is known as what? Nervus furcalis. L4 takes part in the formation of two plexus. All this I've told you, I'm just going through it fast. L4 takes part in the formation of lumbar as well as sacral plexus, whereas L5 forms only sacral plexus. This you know. So I just want you to understand what emerges from this pelvic sacral foramen are the ventral rami of the sacral spinal nerves. Ventral rami of sacral spinal nerves joins with L4, L5 and forms the lumbar plexus. Okay, now as we come anteriorly, what is this going to be? The anterior superior iliac spine. And here we come in front. What is this going to be now? The pubic symphysis. Pubic symphysis. This is the pubic tubercle. This is the pubic tubercle. The part of the pubis. The part of the pubis between the pubic symphysis and the pubic tubercle. This one. What is this known as? The pubic crest. Pubic crest. This is the pubic tubercle, and as we go up, what is that known as? The superior ramus of pubis. Superior ramus of pubis is also known as the pecten pubis. Pecten pubis. Today I am starting the lower limb. And what muscle arises from here is the pectineus. Pectineus. Okay. So look here once again. What is this now? This is the body of the pubis. This is the pubic crest. This is the pubic tubercle. And this is the superior ramus of pubis, also known as the pecten pubis. Pecten pubis, and a muscle arises from there. We call this as pectineus. Okay. Now coming down, This is the inferior ramus of pubis. This is the obturator foramen, and this inferior ramus of pubis joins with the ramus of ischium. Just one moment. That's the femur. I'm just making this as the femur present in this acetabulum. Okay. So now that's the inferior ramus of pubis joins with the ramus of ischium. We now call this as the conjoint istiopubic ramus. Conjoint istiopubic ramus. And what is this now? This is the ischial tuberosity. Ischial tuberosity. Here we are. So that completes my pubic bone, ischium and ilium. Clear to all of you? Just look here once again. What is this now? That's the body of the pubis. Once again, look, this is the pubic crest. That's the pubic tubercle. This is the superior ramus of pubis, also known as the pecten pubis. That's the inferior ramus of pubis, joins with the ramus of ischium, now known as the conjoint istiopubic ramus. Fine. That's the obturator foramen. I'll just make a good obturator foramen. Yes. That's the femur in the acetabulum. Okay, this all we know. Now just have a look at this. Just sit and concentrate. I'll give you time to draw. Do not sit and draw anything. Understand the concept. Okay, what is this from the anterior superior iliac spine to this pubic tubercle? What is this that I have drawn? That's the inguinal ligament. Inguinal ligament. From the anterior superior iliac spine to the pubic tubercle, that's the inguinal ligament. Just listen now, don't sit and talk. Now tell me, what is attached to this inguinal ligament in front? Attached to the inguinal ligament in front are the muscles of the anterior abdominal wall. Okay, so just imagine this external oblique, internal oblique, transverse abdominis. They are the muscles of anterior abdominal wall and they are attached to the inguinal ligament. Okay, and the same external oblique folds and forms the inguinal canal, and the lower border becomes the inguinal ligament. This all you know. Fine. Now, just below this inguinal ligament, just have a look. Muscles are attached to the inguinal ligament. Now, just below this inguinal ligament and above this bone here, above this bone, there's a space. I put the arrow in the space. And this is an area, this is a space. Any structure from this region, what is this region? Lumbar region, or any structure from the pelvis, if it has to come into this region, what is this region now? Femoral region. There's only one way to come to the femoral region. You understanding? Look here once again. This slide which I have drawn is clear. What is attached to the inguinal ligament in front? The muscles of anterior abdominal wall. So you can just imagine below the muscles and the inguinal ligament, this is the space here. And you know what? This space is similar to an area here. Area here. You remember this? What was this for the axilla? You remember this? This was the apex of the axilla. Now just try to correlate everything. I'll quickly in a nutshell give you all the correlations. I hope you remember everything. It will be a quick revision for you. Don't sit and talk anything. Do not chat anything. Just listen to what I'm telling. So you remember this area, this is the apex of the axilla, or this is what we call as the cervicoaxillary canal. And I told you any structure, if it has to come into the axilla, it has to pass through this space, the apex. Similarly, any structure, look, this is so nice, any structure from the lumbar region or from the pelvic region, if it has to come down into the femoral region, and that's the space here, and this is what we call as, this space is known as the pelvifemoral space. Pelvifemoral space, okay? And this pelvifemoral space is similar to apex of the axilla. Now look, just try to understand how nice this is. Now who comes through this space? Look, what structures would be coming through this pelvifemoral space? Just let me finish the slide, don't draw anything. Understand the concept first. Now, this is a muscle which begins from the transverse processes of the lumbar vertebrae. And this muscle which begins from the transverse processes of the lumbar vertebrae, any idea? Any idea what is this muscle? Yes, psoas major. Very good. That was a psoas major. Very nice. And this psoas major, you remember this psoas major would come like this, would go below the, it would go below the inguinal ligament, it would pass through the space, pelvifemoral space, and it will be inserted on the femur. Yeah, that's the psoas major. And you remember there was someone lying on the psoas major, Chalo, guess fast. Yes, you know this. There's someone who lies on the psoas major. A nerve, can you guess? Can you remember that? A nerve. Yes, the genitofemoral nerve. Very good. And there's someone else lying on the psoas major. I told you this. The abdominal part of the ureter. The ureter, you remember the ureter lies on the psoas major and the transverse processes of the lumbar vertebrae. What else lies on the psoas major is the genitofemoral nerve, yeah, which divides into a femoral branch and a genital branch. The genital branch of genitofemoral nerve enters into the spermatic cord in males or the round ligament of uterus in females. All this is known to you. I'm just going through it. Okay, very good. Yes, very nice. And you tell me, look, what is this muscle here? This muscle, this is the iliac fossa, right? And look, this muscle is the iliacus. This muscle which begins from the iliac fossa, this muscle is the iliacus. And look, this is so nice. Now this iliacus would be passing through this space to the pelvic femoral space, and this iliacus would be getting inserted on the femur. Together we call this as the iliopsoas. You must be knowing this as iliopsoas. Okay, so that's the iliacus, that's the psoas major, together known as iliopsoas, right? Just try to recollect what we had done in the abdomen. Now this iliacus is covered by a fascia. I told you that. You remember? That was the fascia iliaca. And the same fascia iliaca covers the psoas major. What is that now known as? The psoas fascia. I've told you all these things. I'm just going through it. And as we go up, this fascia becomes thick. This fascia becomes thick, extends from the body of L1 to its transverse process. You remember what was that known as? Something which I had shown you in the slide also, something which we had drawn like this. A thickening of psoas fascia which extends from the body of L1 to its transverse process. Yes, very good. That is known as the medial arcuate ligament. Medial arcuate ligament. Okay. And there's someone who passes, who enters the abdomen behind the medial arcuate ligament. This also I have told you, this also I've shown you. Yes, who enters the abdomen behind the medial arcuate ligament? The sympathetic chain. Remembering sympathetic chain, I had shown you the slide. Fine. What was this muscle here? The next muscle to psoas major here. You remember this quadratus lumborum. And this quadratus lumborum was covered by a fascia in front. What was that? Anterior layer of thoracolumbar fascia. And then I told you, as we go up, this anterior layer becomes thick, extends from the transverse process of L1 to the 12th rib, and this is what we call as the lateral arcuate ligament. Lateral arcuate ligament. So this was the medial arcuate ligament, this was the lateral arcuate ligament. What was this with reference to that we had discussed? Guess. You know this. What was this with respect to that we had discussed? The medial and the lateral arcuate ligament. Yes, this all gives origin to a muscle. Yes, what was that? The diaphragm. Diaphragm. You remember origin of diaphragm? The vertebral origin we had divided into three sets. The sternal head, the vertebral head, and the costal head. The vertebral head arises from the medial and the lateral arcuate ligament, plus the diaphragm also arises from the bodies of the L1 to 3 vertebrae here and L1, L2 vertebrae on this side. You remember all this now? And what was this for the diaphragm known as? The crus of the diaphragm. Crus. And the right crus of the diaphragm, the right crus of the diaphragm was forming the posterior relation of something. If you remember this. Yes, the right crus of the diaphragm was forming the posterior relation of, guess. This is how you should be able to correlate, okay? If this you are able to correlate, now once your concepts are clear, then you see the slides. The more slides you see, every time you see a slide, you'll get something new out of it, okay? So then it becomes still better to understand. Yes. What's that? What did I tell you? The right crus of the diaphragm. No, stomach bed was left crus. Stomach bed was left crus. I'm asking you, right crus of the diaphragm was forming the posterior relation of something. Tell me who's that? Okay, I'll just give you a hint. The right crus of the diaphragm, the IVC, the right renal vein, and the bile duct. 4 structures. Tell me, this were the posterior relations of what? The right crus of the diaphragm, the right renal vein, the IVC, and the bile duct. All this was forming the posterior relation of. Head of the pancreas, great, very nice. Head of the pancreas, this was forming the posterior relations of the head of the pancreas, very nice. And the left crest of the diaphragm was forming the posterior relation of the stomach bed. Also the left crest of the diaphragm was forming the posterior relations of the body of the pancreas. Okay, I've given you all these things, just read the notes, be perfect with the notes. Okay, you should be perfect. Very nice, very nice. Okay, so that is psoas major. This is the quadratus lumborum, and you remember the third muscle on this side, the third muscle going sideways, that was the transverse abdominis. And I told you the psoas major, the quadratus lumborum and the transverse abdominis together forms what? The posterior abdominal wall. Posterior abdominal wall. So see, there are many things which you can, you need not read abdomen for that. Wherever you're coming to the slides, you can just go through. Okay, quickly tell me now, what was this behind the lateral arcuate ligament? Who enters the abdomen behind the lateral arcuate ligament? The subcostal nerve and vessels. What was this nerve? You remember what was this nerve and what was this nerve? This was the iliohypogastric, this was the ilioinguinal nerve. You tell me there was someone here, a branch of the lumbar plexus lying on the iliacus and coming out at the most lateral aspect of the inguinal ligament, and this is the nerve which gets compressed against the inguinal ligament. The person complains of paresthesia, tingling and numbness along the lateral aspect of the thigh. Name of the condition: Meralgia paresthetica, and the nerve is the lateral femoral cutaneous nerve of thigh. Lateral femoral cutaneous nerve of thigh. Yes. So this is subcostal nerve, this is iliohypogastric, this is ilioinguinal, this is the lateral femoral cutaneous nerve of the thigh. There was someone lying on the psoas major, that was the genitofemoral nerve. Someone lying between the iliacus and the psoas major, that's the femoral nerve. And there's a nerve medial to the psoas major, this is the obturator nerve. So in relation to the psoas major, on the psoas major is genitofemoral, lateral to the psoas is femoral, medial to the psoas is obturator. Indirectly, what have I told you? Indirectly, what have I told you? Indirectly, what have I told you? Guess. I've told you all these nerves, and all these nerves are branches of what? The lumbar plexus. Okay, so indirectly, quickly I've revised the lumbar plexus for you. Clear now? Yes, subcostal nerve is not a branch of lumbar plexus. You know, this is T12, ventral labus of T12, the subcostal. Iliohypogastric, ilioinguinal, lateral femoral cutaneous nerve of thigh, the femoral, genitofemoral and obturator. So these are the branches of lumbar plexus. Okay, that's great. So clear to all of you. I just revised everything for you. Okay, coming now to the actual lower limb. Look, this is the this muscle. What is this? Iliacus. The next to iliacus will be the psoas major. And now have a look at this. What is this part of the pubis known as? I just told you this is the superior ramus of pubis, and this is what we call as the pectineus pubis. And there's a muscle right here. What's this? Pectineus, right? This is the pectineus muscle, pectineus. And there's a muscle which begins from the body of the pubis, and comes down here like this. What is this going to be? This muscle is known as the obturator. This is the adductor longus. I can't superimpose this. This is the adductor longus. So now see, we've got four muscles. One is adductor longus. The next muscle is the pectineus. The next muscle is the psoas major. One moment, the psoas major. That's the psoas major. Okay. And this, the last muscle is the iliacus. Iliacus here. Iliacus. Okay. That's the iliacus. Just 2 minutes. The head of the femur is not going below that. Just try to adjust. And what is this muscle, you tell me now? This is a muscle which begins from the anterior superior iliac spine. That's the muscle which begins from the anterior superior iliac spine and now goes on the medial aspect. Any guess? Guess this. This is the sartorius. Don't draw any time for this. This is the sartorius. Look, this is so nice. What have I made for you? I have made the femoral triangle for you. Femoral triangle. Yeah. So look, the structures from the abdomen would come down into the lower limb, right? So this is the femoral triangle. So what are the boundaries of femoral triangle? Whose lateral sartorius? Whose medial adductor longus? The base is formed by, this is the base, inguinal ligament. The base is formed by the inguinal ligament. And who forms the floor? Floor is formed by 1. Iliacus, 2nd psoas major, 3rd pectineus, and 4th is adductor longus itself. Adductor longus forms the medial boundary. Adductor longus is also present in the floor of the femoral triangle. You're clear to all of you? Understanding this femoral triangle, how I made the femoral triangle for you? Okay. Chalo, we'll starting with femoral triangle. You can draw this later. I'll first finish this femoral triangle for you. Lower limb is very easy. Just try to understand everything. Just muscles, vessels and nerves and the actions of the muscles you have to understand. Femoral triangle. Boundaries. Boundaries. Laterally is the medial border of sartorius. Laterally is the medial border of sartorius. Medial is the medial border of adductor longus. Okay, so laterally is the medial border of sartorius. Medially is the medial border, not the lateral border. It's the medial border of adductor longus. Base, inguinal ligament, and the floor, iliacus, psoas major, pectineus, and adductor longus. Floor is formed by iliacus, psoas major, pectineus, and adductor longus. Clear? Contents. Femoral vessels, enclosed in femoral sheath. Femoral vessels enclosed in femoral sheath. Femoral nerve. Femoral nerve. Femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. Lateral femoral cutaneous nerve of thigh. Femoral branch of genitofemoral nerve, the lateral femoral cutaneous nerve of thigh. Okay. Deep inguinal lymph nodes. Deep inguinal lymph nodes. Topic is femoral triangle. So femoral vessels enclosed in femoral sheath, femoral nerve, the femoral branch of genitofemoral nerve, the lateral femoral cutaneous nerve of thigh, and the deep inguinal lymph nodes. Okay, clear to all of you? So that's about the femoral triangle. Done? Now just finish the slide. If you want, you can draw the slide. Okay, I can magnify only this much. Psoas major, yes. If you want, you draw this, otherwise that's fine. Redis sartorius. Okay, that's it. I put red is sartorius, orange is iliacus, green is psoas major, violet is pectineus, blue is adductor longus. Clear? Don't label the nerves. I'll show you another slide for the nerves. Don't label the nerves. Okay, so that's it. Nerve lateral to psoas is femoral, nerve medial to psoas is obturator, and nerve on the psoas is genitofemoral. So if you're done, you tell me. I'll tell you. This is the done. Merangia panestheticatus, Merangia panesthetica. Done now? Okay, that's it. Now just understand this. Understand this now. Okay. Now see this. Just try to understand. Now, iliacus. Iliacus is covered by what? Fascia iliaca. Iliacus muscle. Iliacus muscle starts from the iliac fossa. The iliacus muscle comes below the inguinal ligament and gets inserted on the femur. And the iliacus is covered by what? Fascia iliaca. Fine. Now, what is in front? What is attached to this inguinal ligament in front? The muscles of anterior abdominal wall, external oblique, internal oblique, and transverse abdominis. So just imagine this is in front, external oblique, internal oblique, transverse abdominis, that's in front. Who's behind the transverse abdominis? The fascia transversalis. Now just imagine in front is external oblique, internal oblique, transverse abdominis. Behind the transverse abdominis is fascia transversalis. And this fascia transversalis from the anterior abdominal wall comes down, goes behind the inguinal ligament and comes in the femoral region. And from behind, I'm showing in a side way. From behind, who comes here? You're looking from the side. This is the fascia iliaca which is coming down, and from front, who's coming down is the fascia transversalis, and this together is what we call as the femoral sheath. That means femoral sheath is formed by two fascias. Who's coming from front, from the anterior abdominal wall, goes behind the inguinal ligament and come down, that's fascia transversalis. And who's coming from behind the fascia iliaca, and together these two fascias forms what we call as the femoral sheath. That means femoral sheath, if you can just tell me, the anterior wall is formed by what? Anterior wall of femoral sheath is formed by fascia transversalis and the posterior wall is formed by fascia iliaca. Just one moment. Okay, that's it. So anterior wall is formed by the fascia transversalis and the posterior wall is formed by the fascia iliaca. I'll show you the slides, it will be clear to all of you. Just have a look. Have a look. Identify the slides and just try to identify the muscles here. Look, this is what I was trying to tell you. Yeah, quickly, just quickly, fast. What is this muscle? Psoas major. That's psoas major. What's that? Quadratus lumborum. What's that? Transverse abdominis. What is this nerve? That's a subcostal. This is the iliohypogastric. This is the ilioinguinal nerve. This is the lateral femoral cutaneous nerve of the thigh. This is the femoral nerve. And what is this nerve? Genitofemoral. And there would be a nerve on the medial side. He's not drawn that. What would this be? Obturator nerve. Obturator nerve. So this is clear now. And then you remember we had placed an organ here like this. You remember this? That was the kidney, and this was forming the posterior relations of the kidney. All this is known to you. Okay, just have a look at this slide now. Just look at this slide. What is this now? This is the inguinal ligament, and these are the muscles of the anterior abdominal wall which are attached to the inguinal ligament. Fine. What is this now? Sartorius. What is this muscle? Adductor longus. So which border of sartorius? Once again, the medial border of sartorius. Which border of adductor longus? Not the lateral, not the lateral. It's the medial border of adductor longus. Why medial? Because suppose if you take the lateral border of adductor longus as the boundary of femoral triangle, adductor longus would then not be included in the floor. Adductor longus is out, no. Adductor longus is out. So adductor longus would not be included in the floor. So if you have to include adductor longus in the floor, we have to take the medial border of adductor longus. The base is formed by what? Inguinal ligament. And what is the floor formed by? Iliacus. Psoas major is behind this. This is the pectineus, and that's the adductor longus. Clear, all of you? And this is the nerve which comes at the most lateral aspect of the inguinal ligament, and this is the nerve which gets compressed against the inguinal ligament. A branch of lumbar plexus, that's the lateral femoral cutaneous nerve of thigh, and when this nerve gets compressed, that is meralgia paresthetica. Meralgia paresthetica. All the images of the previous slides are there on eMedicos. Yesterday only he has uploaded it on eMedicos. Live lectures, you'll get the slides there. Okay, just have a look at this femoral sheath now. Look at this slide. Tell me, what is this here? Just listen now, don't write anything. What is this muscle here? Look at this muscle. This is the iliacus. This is the iliacus, right? And what is this fascia covering the iliacus here? That's the fascia iliaca. That's the fascia iliaca here. And who's coming from front, from the anterior abdominal wall? This is the fascia transversalis. And what is this now? That's the femoral sheath. Understood? So femoral sheath would be formed by two fascias. A fascia which is behind, what's that? Fascia iliaca. And the fascia in front, this is the fascia transversalis. Fascia transversalis. Just have a look at this slide. See, this is a side view. Just get an orientation. This is a view from the side. You're looking from a side view, a sagittal section. You're looking from the side. So to start, what is this muscle now? Iliacus. A side view, iliacus. And he's not drawn that. I'm drawing this for you. What is this now? That's the fascia iliaca. That's the fascia iliaca. What are these three muscles? External oblique, internal oblique, transverse abdominis. And who's behind the transverse? He's not drawn that. That's the fascia transversalis. And this fascia transversalis comes down here. The fascia iliaca comes down. And what is this now? That's the femoral sheath. Understood how the femoral sheath is formed? Clear to all of you? The fascia iliaca just goes down, and the fascia transversalis comes from the anterior abdominal wall, and that's how the femoral sheath is formed. Okay. So anteriorly is fascia transversalis, posteriorly is fascia iliaca. Now my question is, if any structure has to come in the femoral sheath, what should it lie on? If any structure has to come in the femoral sheath, where should it be? What should it lie on? Just understand this now. Look, Now what I'm showing you, this is the iliacus muscle. I'll put on small screen only. That's the iliacus muscle, and I'm making this as what? This is the fascia iliaca. Look, this is the iliacus muscle. This iliacus muscle is covered by what? This is the fascia iliaca. Fascia iliaca. And who's this? You're looking at side view. Who's this coming from front? Fascia transversalis. Now, if any structure has to come in the femoral sheath, it just has to lie on this fascia iliaca. It should just lie on the fascia iliaca. So if a structure lies on the fascia iliaca, and that's the fascia transversalis, and look, this is so nice. Where is the structure now? It's right within the femoral sheath. It's right in the femoral sheath. That means if any structure has to come in the femoral sheath, it just has to lie on fascia iliaca. It just has to lie on fascia iliaca, because fascia transversalis comes directly down. And this is exactly what the femoral artery and the femoral vein does. They lie on the fascia iliaca. They therefore lie in the femoral sheath. But what happens to the femoral nerve? We always say femoral nerve is outside the femoral sheath. Why? Because the femoral nerve is directly lying on this muscle. What is this muscle? I told you, iliacus. The femoral nerve is lying on the iliacus directly. And what's this? Fascia iliaca. And what's this? Fascia transversalis. And what's this? Femoral sheath. So the femoral nerve is outside the femoral sheath. If I want to see the femoral nerve, what do? I just remove the fascia iliaca. And look, that's the femoral nerve lying on iliacus muscle. Am I clear to all of you? This should be clear. Look at this slide. It will be clear to you. Just have a look at this slide. Look, what is this now? This is the fascia iliaca. That's the fascia iliaca. And what's this in front? Fascia transversalis. So what's that? Femoral sheath. So these structures are in the femoral sheath. And look, who's this? Femoral nerve. Femoral nerve is directly lying on which muscle? This is the iliacus muscle, and the fascia iliaca is this. That means the femoral nerve is lying beneath the fascia iliaca. The femoral nerve is therefore outside the femoral sheath. Is this clear to all of you? Okay. And this femoral sheath will have three compartments. One is the lateral compartment, one is the intermediate, and one is the medial compartment. I'll just make the femoral sheath here for you. So that's how the femoral sheath is. There's a lateral compartment, lateral, intermediate, and medial compartment. Who lies in the lateral compartment? The femoral artery and the femoral branch of genitofemoral nerve. Who lies in the intermediate compartment? Femoral vein. And the medial compartment is empty. We call this as the femoral canal. Femoral canal. Yo, I'll show you the slide. Just one moment. Have a look at this. That's the femoral sheath once again. This is very easy. Lower limb is extremely easy topic. Now that you have done everything, you'll find it very easy. Just be with me, you'll understand. So what is this fascia? This is the fascia iliaca. And what's this fascia? Fascia transversalis. Clear now? So that's a femoral sheath. Three compartments here that I was telling you. This is the lateral, this is the intermediate, that's the medial. Who lies in the lateral compartment? The femoral artery plus the nerve, the femoral branch of genitofemoral nerve. In the intermediate compartment is the femoral vein, and the medial compartment is empty. What is this known as? Femoral canal. The upper part of femoral canal is known as the femoral ring. This is the femoral ring. And you have to know the boundaries of this femoral ring. Okay, they are very important. And this femoral ring is closed by a lymph node. What is this lymph node known as? Look at that. The femoral ring is closed by a lymph node. Here, that's the lymph node of Cloquet or Rosenmuller. And what is this lymph node drain? It drains the glans penis and the glans clitoris. Remember, if you get an MCQ stating penis or clitoris drains into, your answer would be the superficial inguinal lymph nodes. But specifically you get an MCQ stating the glans penis, glans clitoris drains into, your answer is the deep inguinal lymph node. That's the lymph node of Cloquet. Okay, this is clear to all of you. Starting with the femoral sheath. A very important MCQ, femoral sheath. I'll start. Be clear with your concepts, huh? You'll be able to answer the MCQs. Concept should be clear. I'll start. Starting with femoral sheath. Start. anterior. Fascia transversalis. Fascia transversalis. Posterior. Fascia iliaca. Fascia iliaca. Again write femoral sheath and make 3 compartments, 3 arrows. Lateral, intermediate, lateral, intermediate, medial. Lateral compartment outlines the femoral artery plus femoral branch of genitofemoral nerve. I am writing it in short, huh? I'll tell you that, I'll tell you, don't worry. I'll be writing everything, just listen to that, I'll tell you. So what lies in the lateral compartment is the femoral artery and the femoral branch of genitofemoral nerve. Intermediate compartment is the femoral vein, and the medial compartment is also known as femoral canal. Also known as the femoral canal. Upper part of femoral canal. Upper part of femoral canal is known as femoral ring. Upper part of the femoral canal is known as femoral ring. Okay. So lateral, intermediate, medial. Lateral compartment is femoral artery and the femoral branch of genitofemoral nerve. The intermediate compartment is the femoral vein, and the medial compartment is empty, also known as the femoral canal. The upper part of the femoral canal is known as the femoral ring. I want you to understand the boundaries of femoral ring. This is extremely important. Boundaries of femoral ring. I'll just explain this to you and then we start. Boundaries of femoral ring. Clear to all of you? Wait, I'll tell you. Lymph node, no lymph node, I'll tell you. I'll tell you that lymph node, just wait now. Now see the boundaries of femoral ring. Have a look here. Understand this now. Boundaries of femoral ring. Don't write anything. Listen to this now. Okay, here we start. What color I'll take? I'm thinking. Okay, I'll start. What is this in front? Look, just try to understand this. What is this anteriorly? What is this one? This is the inguinal ligament. Now this inguinal ligament turns. And what is this turn known as? A turn is known as the lacunar ligament. Lacunar. So inguinal ligament is anterior. It turns like this. That is known as the lacunar ligament. Now the same lacunar ligament goes back here on the pecten pubis. And what is this known as? The pectinate ligament. Pectinate ligament. Look, if you have to draw a slide here for you. One moment, I'll just make a slide here. Don't write anything, just have a look at the slide. See this. I'll make this as the femoral sheath for you. That's the femoral sheath like this. This is the lateral compartment. That's the intermediate compartment. That's the medial compartment. This is the femoral artery plus the nerve. This is the femoral vein. That's the femoral canal. The upper boundary of femoral canal like this is known as what? The femoral ring. This is the femoral ring. Now what are the boundaries of femoral ring? Now who's coming from front? Inguinal ligament. The inguinal ligament turns like this, turns here, and what is this now? Turn known as the lacunar ligament. The same lacunar ligament goes back over that part of the pubis. What is that known as? Pecten pubis. And this is what we call as the pectinate ligament. And who's lateral here? Laterally is the septum separating it from the femoral vein. Laterally is the septum separating it from the femoral vein. Look, I'll show you here. I'll just make this femoral sheath for you. It's very easy, very clear, no? It's very easy to understand this. Now look, I'll start. Have a look here. What's this now? This is the inguinal ligament. The inguinal ligament turns, and what is this turn now known as? Lacunar ligament. The lacunar ligament goes back. What is this part of the pubis known as? Pecten pubis. And what is that known as? Pectinate ligament. And whose lateral? Lateral is the septum separating it from the femoral vein. Right? This femoral ring is closed by a lymph node, and that's the lymph node of Cloquet. Okay, great to you. Great, clear to all of you, no? Fine, chalo, we'll finish this. Right, now boundaries of femoral ring. Anterior. This is very important, and this you have to know. Anteriorly, inguinal ligament. Inguinal ligament, also known as Poupart's ligament. Poupart's, P-O-U-P-A-R-T-S. Inguinal ligament or Poupart's ligament. Medially, lacunar ligament or Gimpernett's ligament. Gimpernett's, so just remember the alternate names. Gimpernett's ligament. Posteriorly, pectinate ligament or Cooper's ligament. And laterally is the septum separating it from femoral vein. This is clear now? The femoral ring is closed by lymph node. Lymph node of Cloquet or Rosenmuller. Drains the glans penis or the glans clitoris. Okay, that's it. Clear to all of you? The femoral ring is closed by a lymph node. That's the lymph node of Cloquet or Rosenmuller. And what does it drain? The glans penis or the glans clitoris. If you get an MCQ, penis or clitoris drains into, your answer is superficial inguinal lymph nodes. But if the MCQ is glans penis and glans clitoris, your answer would be the deep inguinal. That's the lymph node of Cloquet. Clear to all of you? Yes? Okay, so that's about the femoral sheath. Okay, just one more point I'll tell you. Femoral ring is wider in females. This femoral ring is wider in whom? You know, femoral ring is wider in whom? In females. Why? Because the pelvis is wider in females. The pelvis is wider in diameter and the blood vessels are of small size. So automatically the femoral ring becomes very large. It's larger in females. So chances of femoral hernia are more common in whom? Females. Okay, chances of femoral hernia are more common in females. Now suppose you tell me now, if there's a femoral hernia, you are a surgeon and you want to reduce the hernia. You have to push the hernia back. Now you have to dilate the femoral ring, right? You have to dilate the femoral ring so that you can push the hernia back. And to dilate the femoral ring, you need to cut something. You need to cut a boundary of the femoral ring. So which boundary do we cut? We cut the medial boundary. We cut the lacunar ligament. We cut the lacunar ligament. You dilate the femoral ring. You push the contents back. Put a mesh. Fine. That's it. That's it. Done. Okay. But occasionally, rarely, very rarely, there might be something who lies on the lacunar ligament, and if you cut this lacunar ligament, it would lead to hemorrhage. That's an artery. If you can guess, what is that artery which lies on the lacunar ligament? Yes, which is the artery which lies on the lacunar ligament? It's the abnormal or aberrant obturator artery. Abnormal obturator artery lies on the lacunar ligament, and if we cut this ligament, it would lead to hemorrhage. Clear to all of you? And this abnormal obturator artery is a branch of inferior epigastric artery. Yes, we have come to this inferior epigastric artery once again. Abnormal obturator artery is a branch of inferior epigastric. Inferior epigastric. Where was that? Inferior epigastric. Where was this inferior epigastric artery? Remembering inferior epigastric artery. See, to get an MCQ like this now, true about inferior epigastric artery, like you should be able to just try to get everything that you know about the inferior epigastric artery. Just try to recollect this inferior epigastric artery. One, branch of external iliac. Where does this inferior epigastric artery lie with respect to the deep inguinal ring? Yeah, deep inguinal ring, we had made this inferior epigastric artery. This inferior epigastric artery lies medial to the deep inguinal ring. Yes. And this inferior epigastric artery differentiates between an indirect and a direct inguinal hernia. Something else, this inferior epigastric artery is going to anastomose with the superior epigastric artery in the rectus sheath, right? And the branches of inferior epigastric artery are two. One, if you can tell me this. One I told you now, that's an abnormal obturator artery. Second, you can guess. Second, I've told you this. Which is the other branch of inferior epigastric artery? Something which lies in the spermatic cord. Cremasteric artery. Very good. So two branches of inferior epigastric. One is the cremasteric artery and the second one is the abnormal obturator artery. Okay, like this is how you should be very clear with your concept. Like any MCQ comes now, you should just try to, before you read the options, just try to recollect everything that you know about the question, and once you are thorough with all these things and then see the options, it will be very easy, right? Very nice. Yes. So femoral ring is whiter in females. Yes. Due to femoral ring is whiter in females due to one, white pelvis. Second, smaller size of the blood vessels. Femoral ring is whiter in females due to one, whiter pelvis and smaller size of the blood vessels. Occasionally, abnormal obturator artery. Branch of inferior epigastric lies on lacunar ligament leading to hemorrhage. Okay. So occasionally abnormal obturator artery, a branch of inferior epigastric, lies on the lacunar ligament leading to hemorrhage. Okay, so that completes my femoral triangle, femoral sheath, femoral ring, the boundaries of femoral ring. Okay. Is this clear to all of you? So now we start with femoral triangle. Okay, just answer this MCQ. Regarding femoral canal, which is correct? Smaller in females, that's wrong. It's wider in females. Contains the femoral vein, that's wrong. It's empty, no? The femoral canal is empty. Inferior epigastric artery lies medially, that's wrong. It's a branch of inferior epigastric. What's that? Abnormal obturator artery. It's the medialmost compartment of the femoral sheath. Medialmost compartment of the femoral sheath. Okay. Fine, that's it. So very good. So clear to all of you. Now starting with this thigh. Yes, very nice. Now listen here. So starting with the thigh, very easy. You just need to know the compartments of the thigh. So there's an anterior compartment, there's a medial compartment, and there's a posterior compartment. There's a nerve for each compartment. Anterior compartment is femoral nerve. We have seen this nerve, branch of lumbar plexus. You know many things now. We just have to correlate. Medial compartment is obturator nerve, and posterior compartment is the sciatic nerve. So before I start with the thigh, just see this. You know, this. Okay, one moment. This thigh is surrounded by a fascia. Look at this. This entire thigh is surrounded by a fascia, the deep fascia of the thigh. The deep fascia of the thigh is known as the fascia lata. Fascia lata. Just listen. Fascia lata is the deep fascia of the thigh. And this fascia lata, as we come on the lateral aspect, lateral side, this fascia lata splits like this. It splits into two. One layer is attached to the acetabulum, and the other layer is attached to the iliac crest. Look, what is fascia lata? It's a deep fascia of the thigh. The fascia lata encloses the thigh on the lateral aspect. This fascia lata splits into two layers. One layer is attached to the acetabulum and the hip joint, and the other layer is attached to the iliac crest, encloses a tract on the lateral aspect, and this is what we call as an iliotibial tract. Just listen it once. I'm giving a reference, okay? So iliotibial tract is formed due to splitting up of what? The fascia lata. Into this iliotibial tract, there are two muscles which are inserted. One muscle which makes the tract tense. What's that? The tensor fascia lata. And the second muscle is the gluteus maximus. Okay? So I just want you to understand at this point of time that the deep fascia of the thigh is known as fascia lata. On the lateral side, it encloses a tract, iliotibial tract, and into this iliotibial tract, two muscles are inserted. One is gluteus maximus, and the second one is tensor fascia lata. Okay. Now, the same fascia lata, as we come in front, it is fixed to a line drawn laterally from the pubic tubercle. A line drawn laterally from the pubic tubercle. If you draw a line, the deep fascia of the thigh is fixed to this line. And this line extending from the pubic tubercle on the lateral side is known as the Holden's line. Holden's line. We'll see this later. What is Holden's line and all. I'm just giving you a reference. Okay, fine. So now starting with the thigh, just have a look. I'll start. Now, what is this muscle here? Don't write anything. I'll be writing all those things for you. Just listen to this. This muscle, anterior compartment, I'm starting. Anterior wall of femoral sheath is formed by inguinal ligament, also known as Poupart's ligament. P-O-U-P-A-R-T-S. Poupart's ligament. Clear to all of you? Fine. I'll start. Anterior compartment of the thigh. This muscle is known as sartorius. Now, what is the origin of sartorius? It begins from the anterior superior iliac spine. anterior superior spine. Now see the direction of this muscle. It starts from the lateral side and it is going towards the medial side. It is crossing from lateral to medial side. So what would it do? What would its action be on the hip joint? I told you, when any muscle acts, it always brings its insertion close to its origin. Insertion close to its origin. So when this muscle contracts, it would take the thigh outwards. What would this be? Abduction, abduction. It would also turn the thigh like this, outwards, outwards. What would this be? Lateral rotation. So one is abduction, second is lateral rotation. And any muscle which is anterior to the hip joint, in front of the hip joint, when it contracts, what does it do? Flexion of the hip joint, flexion. So it would cause flexion of the hip joint, flexion. So action of sartorius on the hip joint would be abduction, lateral rotation and flexion. Now the same sartorius also crosses the knee joint, and where is it inserted on? Look at this, sartorius is inserted on, that sartorius is inserted on the medial aspect of the shaft of tibia, medial aspect of shaft of tibia. Vessel. On the medial aspect of shaft of tibia, there are three muscles which are inserted from three compartments of the thigh. Just listen and don't write anything. From the anterior compartment comes the sartorius. From the medial compartment, I'll just make here for you. From the medial compartment comes the gracialis. And from the posterior compartment comes the semitendinosus. Okay? So sartorius, gracialis and semitendinosus together are known as what? The gyrobes. And these three muscles are inserted on the tibia, on the medial aspect of the shaft of tibia. Medial aspect of the shaft of tibia. Now tell me, when any muscle, coming from the thigh, a muscle is coming from the thigh, this is the tibia, comes and gets inserted on the tibia, slightly posterior to the midline. You divide tibia into two halves and slightly behind the midline. A muscle coming from the thigh like this, getting inserted on tibia, slightly behind the midline. When this muscle contracts, what does it do? Flexion at the knee joint, flexion at the knee joint. And when any muscle from the thigh comes and gets inserted on the anterior aspect of tibia, when it contracts, what does it do? Extension. So these three muscles, sartorius, gracialis and semitendinosus, they come and get inserted on the medial aspect of the shaft of tibia, and all these three muscles, when they contract, they would do what? Flexion at the knee joint, and because they are on the medial aspect, they would also turn the knee inwards. What's that? Medial rotation. So flexion and medial rotation. You're following now, all of you? Yes, flexion and medial rotation at the knee joint. Three muscles, sartorius, gracialis and semitendinosus. They will cause flexion and medial rotation at the knee joint. Fine. Okay. So now you tell me, what is the action of sartorius? We're discussing the sartorius for now. So what is the action of sartorius on the hip and on the knee joint? Have a look. On the hip joint, it does what? Abduction, lateral rotation and flexion. Clear to all of you? Abduction, lateral rotation, flexion. On the knee joint, it does what? It does flexion and medial rotation. Sartorius is also known as what? Sartorius is also known as a honeymoon muscle. Honeymoon muscle is sartorius. You understand the action, you'll understand why it is known as a honeymoon muscle. What does it do to the thigh? It does abduction, lateral rotation and flexion. At the hip joint, on the knee, it does flexion and medial rotation. So sartorius is also known as a honeymoon muscle. You know another muscle whose actions are exactly opposite to that of sartorius. Who's that? And a muscle whose actions are exactly opposite to that of sartorius on the hip joint. Knee joint action same. On the hip joint, it does adduction and medial rotation. Who's this? Gracialis. So gracialis is also known as an anti-rapist muscle. Anti-rapist muscle, gracialis. What is the action of gracialis? What does it do? Adduction and medial rotation at the hip. Adduction, medial rotation at the hip joint, anti-rapist muscle. What is the action of sartorius? Abduction and lateral rotation at the hip joint. A honeymoon muscle. So different actions on the hip joint, but in knee joint the action is the same, flexion and medial rotation. Clear to all of you? That's about sartorius. A very important MCQ is sartorius. Be very clear with this muscle. And lower limb, now you have to be perfect with the origin and insertions of this muscles. So answer this MCQ. All the following statements concerning sartorius muscle are correct except. It is known as a talus muscle. Yes. It's the longest muscle. Yes. Acts on two joints. Yes. The hip and the knee joint. It extends the hip. Wrong. It flexes the hip joint. It is a flexor. No? Just remember one thing. The muscles who are in anterior, in front of the hip, are always going to flex the hip joint. Okay. That's it. So starting with the medial, starting with the anterior compartment of the thigh. Be fast now. Just need to know the muscles and the nerve supply of this muscles. Very easy it is. Anterior compartment of the thigh. Start with me. Sartorius. Sartorius. Origin. Anterior superior iliac spine. Insertion. Medial aspect of the shaft of tibia. Medial aspect of the shaft of tibia along with medial aspect of the shaft of tibia along with gracilis and semitendinosus. Origin is anterior superior iliac spine. Insertion is medial aspect of the shaft of tibia along with gracilis and semitendinosus. Action. Abduction. Lateral rotation. Flexion at the hip joint. Flexion and medial rotation at the knee joint. Also known as talus muscle. Honeymoon muscle. Okay, that's it. Anterior superior iliac spine. ASIS is anterior superior iliac spine. Okay, ASIS is anterior superior iliac spine. So insertion is on the medial aspect of the shaft of tibia along with gracilis and semitendinosus. Action is abduction, lateral rotation and flexion at the hip, flexion at medial rotation at the knee joint, also known as talus muscle or honeymoon muscle. Okay, so that's about sartorius. Understand the next muscle now. See this, huh? Okay, we start. Now we remove the sartorius. And what is this muscle? What is this muscle? A straight muscle. Look, anything straight is known as what? Straight. A straight is known as rectus. And this is of the femoral region. What we call this as rectus femoris. Rectus femoris. Anything else with the term recti? Have we come across recti? You can just guess that. Recti. Rectus femoris. Anywhere else have we come across recti? Recti. Vasa recti. Remembering vasa recti? Together they are known as gyropes. Nerve supply, I'm telling you, nerve supply is femoral nerve. I'll tell that later. Yes, vasa recti. You remember vasa recti? They arise from the marginal artery of Drummond. You remember that single artery which, the artery which formed due to anastomosis, which runs along the margins of the colon, and that's marginal artery of Drummond. And from this marginal artery, those straight branches were known as vasa recti, which enters the walls of the colon. Vasa. And vasa blood vessels recti is straight. So vasa recti. So this is rectus femoris. Nerve supply, I'll tell you later. Just wait. Now we get three muscles by the name of vastus. Look, this is so nice. This is vastus medialis, this is vastus lateralis, and we remove this rectus femoris, we come to another muscle here. Look, this is vastus intermedius, vastus intermedius. So this is vastus lateralis, this is vastus medialis, this is vastus intermedius, and this is rectus femoris, together known as the quadriceps femoris. And this quadriceps femoris is inserted on, what's this bone? Patella. This quadriceps femoris is inserted on the base of the patella, and what begins from here is the ligamentum patellae attached to, ligamentum patellae is attached to what? What's this here? This would be the tibial tuberosity. Ligamentum patellae is attached to tibial tuberosity. Okay, so this is the quadriceps femoris. What is the action of this quadriceps femoris? It crosses the knee in front. So when they act, they cause extension at the knee joint. Quadriceps femoris will do extension at the knee joint. Okay, clear to all of you? Something else which is very important, just one moment, I'll just magnify this. Look here. Quadriceps femoris will cause extension at the knee joint. Okay. Now tell me, you're sitting down. You're all sitting down like this on the chair. Your knees flexed like this. Knees flexed. This is tibia. This is femur. You can see from a side view. This is tibia. This is femur. You're sitting on the chair. This is tibia. This is femur. Your knees flexed. Now when we're standing up, you're standing up. You're putting the foot on the ground. The foot is on the ground, and now you're extending the knee joint. You're extending the knee joint. Look what happens. The lateral condyle of femur fits into the lateral condyle of tibia. Same diameter. The lateral condyle of femur articulates with the lateral condyle of tibia. But the medial condyle of femur is larger in diameter. It's larger in diameter. So this is tibia, this is femur. When we are extending the knee joint like this, the lateral condyle of femur articulates with the lateral condyle of tibia, same diameter. But the medial condyle of femur is larger. For it to articulate, the medial condyle of femur has to undergo this. What's this? A medial rotation, and this is what we call as locking of the knee joint. This is locking of the knee joint. Simple it is. So see, basically why does locking occur? Because the medial condyle of femur is larger in diameter, and for this medial condyle to completely articulate, the femur has to undergo a medial rotation, which we call this as locking of the knee joint. Clear? So when does locking occur? Locking occurs during the final stages of extension. That is the medial rotation of femur during the final stages of extension when the foot is on the ground. Foot is on the ground. Means when the foot is on the ground and when you're standing up, the femur is going to turn medially. Okay, and that is locking. Okay, now just understand the reverse way. Now that you're sitting on the chair, and you're swinging your legs. You understand? You're moving your legs like this. You're swinging your knee joint. You're moving your leg, and now you do this. This is also locking. Just imagine you're sitting on the chair. You're moving your knee joint to and fro, and you do this. This is also locking. In this case, who rotates? In this case, who rotates? Guess. In this case, now who's moving tibia? No, femur is fixed. So in this case, who rotates? The tibia. And how the tibia will rotate? The tibia is going to rotate laterally. It's very easy. Just one moment, I'll just do this. Yeah, the tibia is going to rotate laterally. See, remember it like this. When we're standing up, when we're standing on the ground, who's fixed? Tibia is fixed. Tibia is fixed. So who rotates? Femur. And how does the femur rotate? Medially. Locking. Clear. Fine. And now when you're sitting on the chair, who's fixed? Femur. And who's moving like this? Tibia. So who will rotate? Tibia. And how? Laterally. Both the cases, this is locking. Is this clear to all of you? And just one thing in coordination to this, when the femur undergoes a medial rotation like this, medial rotation, there has to be someone who's going to form an axis for the femur. There has to be someone whose support the femur takes to turn medially. And who's this? ACL, anterior cruciate ligament. And this is how we know that the ACL becomes taut, tensed during extension. So there are so many things associated with this. The ACL becomes taut, tensed during extension because it's the support of ACL which the femur takes to undergo a medial rotation. Understand? So many things with this, with respect to this. So we'll start now. So clear now? Anterior compartment of the thigh, it's very easy. You just have to understand the muscles and the actions of the muscles. Starting here. Next muscle, we're discussing the anterior compartment. Second muscle is vastus medialis. Vastus medialis. Vastus intermedius. Vastus lateralis. Rectus femoris. Very gracious, I'll tell you, see, I'll be telling you everything, don't worry. I just give a reference, just be with me, you'll understand. I'll be telling you everything. If I'm not told something at this point of time, that means I have just given a reference to it. So vastus medialis, intermedius, latalis and rectus femoris together known as quadriceps femoris. Quadriceps femoris inserted on base of patella, inserted on the base of patella, continues as decommenting patella, inserted on tibial tuberosity, inserted on tibial tuberosity. Action, extension at knee joint, extension of the knee joint, locking of the knee joint. I'll just tell you what is locking of the knee joint. Medial rotation of femur, medial rotation of femur during, understand it right? Everything should be clear here and here itself in the class. Medial rotation of femur during the final stages of extension, when the foot is on the ground. When the foot is on the ground, what is important I'm telling you, or Lateral rotation of tibia when the foot is off the ground. Lateral rotation of tibia when the foot is off the ground. You know, this rectus femoris arises from anterior inferior iliac spine, and the other muscles, they will arise from the femur. The vastus, now they arise from the femur itself. They originate from the femur, from the anterior aspect and the lateral and the medial sides. There's nothing much important about that. So what is important, I'm telling you. Lateral rotation of tibia when the foot is off the ground. This is clear to all of you? Who stabilizes the patella? No? That's vastus medialis. Vastus medialis. There's a natural tendency of patella to displace laterally. When we extend the knee, no, the patella has got a natural tendency to go laterally. So who's going to prevent this? Vastus medialis. So vastus medialis out of this force stabilizes the patella. Fine. We'll see that later. Origin, rectus femoris arises from the anterior inferior iliac spine, rectus femoris. The rest of them will arise from the femur. There's nothing much important about it. Clear to all of you? So that's about the okay. Now coming to this, the nerve, this compartment is called femoral nerve. Understand this now. This is a very important MCQ. Femoral nerve. So we've done with anterior compartment, starting with femoral nerve. Right, now you know many things about the femoral nerve. I'll put the slide later if anyone has missed. Starting with femoral nerve. Okay, these are easy things, just understand them first. So we'll start after now, femoral nerve. Femoral nerve is a branch of what? What do you know? I've told you this in lumbar plexus. You remember femoral nerve is a branch of lumbar plexus. Lumbar plexus. What is the root value of femoral nerve? Root value. Insertion likha na baba. Insertion is on the base of the patella and it continues as ligamentum patellae, which is inserted on tibial tuberosity. Okay, now listen. Femoral nerve is a branch of lumbar plexus. What is the root value of femoral nerve? Root value L234. You remember lumbar plexus L234. There was something very specific about the femoral nerve. It is formed by the dorsal divisions of, yes, dorsal divisions of who forms the plexus? Ventral ramus of L2, L3, L4. So dorsal divisions of the ventral rami of L2, L3, L4. That's the femoral nerve. You remember the ventral divisions of ventral rami of L2, 3, 4 forms what? Ventral divisions of ventral rami of L2, 3, 4 was forming obturator nerve. That was obturator nerve. This is femoral. Okay, then the femoral nerve lies in this groove between this and this muscle. What is this? Iliacus and psoas major. What do you call this groove as? Iliopsoas groove. That's the iliopsoas groove. The femoral nerve comes out through this pelvifemoral space. You can see this inguinal ligament. That's the pelvifemoral space. The femoral nerve comes out. What is this region now? The femoral region. The femoral nerve has got a trunk and two divisions like this. It has got a main trunk and two divisions. Understand the femoral nerve as we are writing with this topic, femoral nerve, a very important topic. Okay, starting with femoral nerve, understand this. A very important MCQ, femoral nerve. It is the largest branch of lumbar plexus. Largest branch of lumbar plexus. Largest branch of lumbar plexus formed by dorsal divisions of ventral rami of L2, 3, 4. Dorsal divisions of ventral rami of L2, 3, 4 lies in iliopsoas group. Lies in the iliopsoas group. It has a trunk, anterior and posterior divisions. It has a trunk, anterior and posterior divisions. You can tell me if any other nerve had a similar picture. Trunk, anterior and posterior division. Any other nerve which was exactly similar to femoral nerve. Any other nerve which was exactly similar to femoral nerve. Trunk, anterior and posterior division. Chalo, guess fast. Guess fast, this was very important. I told you. A nerve which had a trunk, anterior and posterior division. A nerve which was coming out through the foramen ovale. Mandibular nerve. Very good. Mandibular nerve. Remembering it had a trunk, anterior and posterior division. What are the branches of the trunk? A quick review. One was nervus spinosus. Second was nerve to medial pterygoid, which also supplies the tensor palati and tensor tympani. Yes, the anterior division gives 3 muscular, 1 cutaneous branches. 3 muscular branches to 1 the temporal nerve, the masseter nerve, and the nerve to lateral pterygoid. 1 sensory branch, that is buccal nerve, and this buccal nerve supplies the skin over the buccinator. Someone had asked this question yesterday, which I had answered on the club. Buccal nerve supplies the skin over the buccinator. That's a sensory nerve. Buccal nerve, which is sensory, is a branch of mandibular. You've got a similar buccal nerve, which is a branch of facial, which is motor, which supplies the buccinator. Fine. So buccinator is supplied by buccal branch of facial nerve, and the skin over the buccinator is supplied by the buccal branch of mandibular nerve. You're getting this now? No, don't get confused. I'm just giving a reference. Posterior division gives 3 branches. One is lingual nerve, second is inferior alveolar nerve, and the third one is auriculotemporal nerve. And the inferior alveolar nerve gives a branch named nerve to mylohyoid, which also supplies the mylohyoid and the anterior belly of digastric. That's it. So that's how quickly you revise things. Okay. So you should be able to get such cross references. Only then you will be perfect. Okay, so that's the trunk. I'll make it like this. This is the trunk, this is the anterior, and that's the posterior division. So what are the branches from the trunk? One, you can just make this diagrammatic representation. One is nerve to iliacus. Nerve to iliacus. Second is nerve to pectineus, lateral half. Nerve to pectineus, lateral half of pectineus. Okay, so we've discussed composite muscles in the upper limb, so there will be composite muscles in the lower limb also. A quick review of composite muscles of the upper limb. One, you're in sequence, pectoralis major. Next in sequence, you remember brachialis. Next, your flexor digitorum profundus, and then here flexor pollicis brevis. You know everything I've told you, everything you've written down. So there are some composite muscles in the lower limb also. One would be pectineus. So branches from the trunk. One is dorsal division of ventral rami. Dorsal division of ventral rami of L2, 3, 4. Sorry, it's on that side. Okay, dorsal division of ventral rami. Okay. So nerve to iliacus, nerve to pectineus. Right. Anterior division gives one muscular, two cutaneous, one muscular, two sartorius. This is the easiest way of understanding the femoral nerve. Two cutaneous branches. One is the medial and anterior femoral Medial and anterior femoral cutaneous nerve of thigh. One muscular, two cutaneous branches. One muscular branch to sartorius, two cutaneous branches. One is the medial and anterior femoral cutaneous nerve of thigh. Posterior division gives four muscular and one cutaneous branch. Four muscular, one cutaneous branch. Muscular branches to quadriceps femoris. Quadriceps femoris, cutaneous branch. Okay, I'll tell you. Why is this so important? You tell me. Medial and anterior femoral cutaneous nerve of thigh. So anterior division gives one muscular, two cutaneous branches. One muscular branch is the sartorius, two cutaneous branches. One is the medial and anterior femoral cutaneous nerve of thigh. Just look at the slide one moment. Medial and anterior femoral cutaneous nerve of thigh. Yep. See this? Who supplies the skin here? On the medial side. Who supplies the skin on the medial aspect of the thigh? That's the medial femoral cutaneous nerve of thigh. Who supplies the skin on the anterior aspect of the thigh? That's the anterior femoral cutaneous nerve of thigh. The medial and anterior femoral cutaneous nerves are branches of anterior division of femoral nerve. I'm very specifically telling you this. Why? Because the lateral, who's this? This is the lateral aspect of the thigh. And who's this nerve? That's the lateral femoral cutaneous nerve of the thigh. And this lateral femoral cutaneous nerve of the thigh is a direct branch of lumbar plexus. Understood this? This lateral femoral cutaneous nerve of the thigh is a direct branch of lumbar plexus. Intermediate and anterior is the same it is. It's a direct branch of lumbar plexus, and the compression of this is known as meralgia paresthetica. Meralgia paresthetica. Okay, no? So this is what I want you to understand. Anterior is also known as intermediate. The other name for anterior is intermediate. So no confusion now. Anterior or intermediate femoral cutaneous nerve. Okay, so posterior division gives four muscular to one cutaneous branch. Muscular branches is quadriceps femoris. Cutaneous branch is saphenous nerve. Saphenous nerve, a very important MCQ. Saphenous nerve. One cutaneous branch is saphenous nerve, and this saphenous nerve supplies the skin over. Saphenous nerve supplies the skin over medial aspect of the leg, and the foot up to ball of the great toe. I'll tell you what this is. Supplies the skin over the medial aspect of the leg and the foot up to the ball of great toe. Clear to all of you? The writing is over. This is the femoral nerve, a very important MCQ. So saphenous nerve supplies the skin on the medial aspect of the leg. I'll show you the slide. One moment. Have a look at this. Oh, this now. Have to keep on. Yep, that's the saphenous nerve. That's the saphenous nerve. It supplies the skin on the medial aspect of the leg and the foot up to the ball of the great toe. Not the great toe, up to the great toe. It's up to the great toe. Intermediate is anterior. Intermediate or anterior, it's the same. One muscular branch. From the posterior division you get one muscular branch. Four. What happened? From the posterior division you get four muscular. अरे क्या है? Four muscular है ना, and one cutaneous है. Where is the confusion? Four muscular. I've written everything. There should be no confusion in this. Posterior division gives four muscular है. Four muscular. This is not one. This is four muscular है ना, चार है ना quadriceps femoris. So four muscular branches. So clear to all of you? Understand this slide which I am drawing now. A very important MCQ again. That's a foot. That's a foot. That's a sole, plantar aspect of the foot. Tell me now, who supplies the skin on the medial aspect of the foot up to the great toe? Up to the great toe. Who's this? Saphenous nerve. This is saphenous nerve. Who supplies the skin on the medial aspect of the great toe? On the medial aspect of the great toe, who's this who's going to supply the skin? Medial aspect is left. This is the superficial. I'll make this large. Superficial peroneal nerve. Superficial peroneal nerve. All the web spaces, you understand web spaces, this one, this one, this one. All the web spaces are supplied by superficial peroneal nerve. This is superficial peroneal nerve. Except the first web space, this one where we put our slippers, this is supplied by whom? Deep peroneal nerve. Deep peroneal. And the lateral aspect of the foot is supplied by whom? Lateral aspect is supplied by sural nerve. Sural is a branch of tibial nerve. Sural is a branch of tibial. The sole of the foot. The sole of the foot is supplied by whom? Tibial nerve. Tibial nerve. 3.5 fingers. 3.5 fingers is supplied by medial plantar nerve. Lateral plantar nerve. Medial and lateral plantar are branches of, this is plantar aspect, this is plantar surface. This is sole, don't get confused, this is the sole of the foot, no confusion. Sole. Clear to all of you? Okay, this is a very important slide. You get plenty of options in the MCQs on this, clinical MCQs also. Clear? If you're done, you tell me. Like a person is undergoing vivisection, a patient burns, undergoes vivisection, and while while we are doing a vivisection, the nerve which is accompanying the great saphenous vein is cut. The person will be experiencing a loss of sensations over which area? So that will be the medial aspect of the foot up to the great toe. That's how you have to know this. So medial aspect of the foot up to the great toe, saphenous. The medial aspect of the great toe, superficial peroneal. All the web spaces, superficial peroneal. The first web space, deep peroneal. The lateral aspect of the foot, sural. Sural is a branch of tibial. The heel of the foot, heel, sole, the heel of the foot, tibial nerve. 3.5 fingers on the medial aspect, medial plantar. 1.5 fingers on the lateral side is lateral plantar. Medial and lateral are both branches of tibial nerve. Medial and lateral plantar are branches of tibial nerve. Both are branches of tibial nerve. Okay, both are branches of tibial nerve. Clear? That means the entire sole is supplied by whom? Tibial nerve. Look, this is so nice. This is so nice. This is exactly similar to 3.5 plantar aspect. Palmar aspect. Palmar aspect. This is plantar aspect. You remember 3.5 fingers on the palmar aspect? Nerve. Who was the nerve? 3.5 fingers on the palmar aspect. Who was supplying this? Medial nerve. 1.5 fingers. Ulnar nerve. So medial nerve corresponds to which nerve of the lower limb? Medial plantar. And ulnar nerve corresponds to which nerve of the lower limb? The lateral plantar. Understand? Just try to correlate like this. Superficial peroneal, deep peroneal, these are branches of what? Will come to this later. Just wait. We'll come to this. I have not reached the left leg up till now. You'll understand that. These are branches of sciatic nerve. We'll see that later. Clear to all of you? So that completes my okay, done. Now, starting with medial compartment of the thigh. Starting with medial compartment of the thigh. Okay. Yep. Not superficial, deep branch of ulnar nerve. Starting with the medial compartment, so that was about the anterior compartment of the thigh. Starting with the medial, I'll just tell you one artery also. I'll tell you the artery in the anterior compartment. So if you can just answer this. This is the artery in the anterior compartment of the thigh. Just wait, I have to finish this. Today I have to finish everything. I think only 4 days, but you know, for you people I've taken 5 days because I've gone very slow. That's okay, that's no problem. Okay, I'll start. Look, quickly tell me, what is this artery? This is the inguinal ligament, right? Chalo, answer now. What is this artery? This is the external iliac. And the external iliac gets down, goes below the inguinal ligament, and the moment it crosses the inguinal ligament, it is now known as what? Femoral artery. Femoral artery. Okay, so femoral artery is a continuation of external iliac after it crosses the inguinal ligament. Fine. The femoral artery first runs this. It first runs in this triangle. What is this triangle? Femoral triangle, right? So femoral artery first runs in the femoral triangle. Where the femoral triangle ends, there's a small canal here. What is this canal? Adductor canal or the Hunter's canal. So femoral artery first runs in the femoral triangle, then comes in the adductor canal. Here, that's the adductor canal here. Right? This is the adductor canal. So in the adductor canal, the femoral artery is going to pierce a muscle. What is this? Adductor magnus. It pierces the adductor magnus. It goes backside. And it is now known as what? Look. It is pierced the adductor magnus, and what is this artery now known as? Popliteal artery. Popliteal artery. Easy. So femoral artery is a continuation of external iliac. Below the inguinal ligament, the femoral artery pierces the adductor magnus and continues as popliteal artery. Then to know the branches of femoral artery. That's the only thing that is important here. One branch is very important. You need to know this branch. Okay, starting with femoral artery. Starting with femoral artery. So we'll start. It takes longer time on this lectures. Okay, start now. Femoral artery. Be fast. Continuation of, I'm writing in shorter, you write it down. Continuation of external iliac below inguinal ligament. Continuation of external iliac below the inguinal ligament. Continues as continues as popliteal artery. After it pierces adductor magnus at the hiatus magnus. Hiatus is an opening in the adductor magnus. It's an opening in adductor magnus. Clear? Continues as popliteal artery after it pierces the adductor magnus at hiatus magnus. Then branches. Speak faster. Superficial and deep. Superficial branches, deep branches. Superficial branches, you know this. Superficial epigastric. I need a reference here. I need a reference. Superficial epigastric. Where have I given you a reference? Answer. Where have I given you a reference? Superficial epigastric. I've told you this n number of times. Superficial epigastric. Superficial epigastric. Where did I tell you this? You remember superior epigastric? Superior epigastric artery is a branch of internal thoracic. The superior epigastric artery passes through foramen of Morgagni and anastomosis with inferior epigastric artery. This was superior epigastric. When I was telling you the superior epigastric artery, I had given you a reference of superficial epigastric artery, and this superficial epigastric artery is a branch of femoral artery. And you know, then I told you there's a superficial epigastric vein, if you remember, and this superficial epigastric vein drains into. Answer. Yes, superficial epigastric vein drains into. No, not femoral. You know, there was a big MCQ, a big flowchart that we had written: obstruction to the SBC below the opening of esophagus vein. Remembering? This vein up here, what was that? Lateral thoracic vein. And which was a vein in the lower limb? Superficial epigastric vein, which drains into great saphenous. And what was this vein which was connecting the lateral thoracic vein with the superficial epigastric vein? Thoracoepigastric vein. Everyone is following now? Yes. So that's how you should be able to correlate. Actually, this is very late. That's okay. In this lecture I got late. That's fine. Superficial epigastric. Superficial, circumflex, iliac, yes, and superficial, external pudendal. Okay, these are the superficial veins. Superficial epigastric, superficial circumflex iliac, superficial external pudendal. This supplies the external genitals. Superficial external pudendal will supply the external genitals. Yes. Deep branches, muscular branches will supply the muscles. Deep external pudendal. Muscular branches, deep external pudendal, and third, anything deep, anything deep is known as what? Profunda is a deep, so profunda femoris. I need a reference here. Profunda femoris. Where had I given you a reference? Profunda brachii. You remember profunda brachii? It's a branch of brachial artery, and the profunda brachii, along with the radial nerve, lies in or passes through. If you can guess that, the radial nerve and the profunda brachii artery passes through. This was a very important MCQ. Passes through the lower triangular space. Remembering spaces around the arm. Passes through lower triangular space. Enters the spiral groove. Or the radial groove. That was profunda brachii. This is profunda femoris. Okay, very nice. And this profunda femoris now gives 3 branches. This is why it is so important. Yes, very good, very nice. You are answering very well. Very good. So profunda femoris gives 2 branches. Look, this is so nice. Out of this 3 branches, out of which 2 branches are going to wind around the femur. They wind around the femur. One from the medial side, one from the lateral side. We call this as the medial circumflex femoral and this as the lateral circumflex femoral. And the medial and the lateral circumflex femoral gives branches, and these branches are going to supply the head and the neck of the femur. Very important. Name. What are these branches which arise from the medial and the lateral circumflex femoral which are going to supply the head and the neck of the femur? Retinacular branches. Retinacular branches of the medial and the lateral circumflex femoral. So, avascular necrosis occurs if these arteries are, if there's a fracture of the neck of the femur. Okay, so profunda femoris gives medial circumflex femoral, lateral circumflex femoral, medial and the lateral circumflex femoral together gives retinacular branches which supply head and neck of femur. Head and neck of femur. And the third branch is perforating branches. The next is the perforating branches. Piers. I'll show you the slide. Piers. Adductor. Adductor brevis and magnus and supply the muscles in the posterior compartment. That completes my entire anterior compartment of the thigh. Okay, perforating branches. I'll show you the slide. This perforating branches are branches of what? Profunda femoris. And what are they going to pierce? They are going to pierce the adductor brevis and adductor magnus. And what are they going to supply? They are going to supply the muscles in the posterior compartment of the thigh. Look at this slide. It will be clear to all of you. Have a look. Look up. Look, this is nice. This is the external iliac. That's the femoral artery. Femoral artery we've cut here. That's the femoral which is cut. What is this deep branch of femoral? That's the profunda femoris. And this profunda femoris gives, this is 1, 2, 3 and 4. There are 4 perforating branches. And what are these branches going to pierce? What are these perforating branches going to pierce? This is adductor brevis and this is adductor magnus. Now medial compartment I have to tell you. They pierce the adductor brevis, adductor magnus, and now they will go backside. They go backside. Where do they go? They go in the posterior. Look, these are the perforating branches of profunda femoris. They come in the posterior compartment, and what are they going to supply? They supply the muscles in the posterior compartment of the thigh. Clear? So that's about the femoral artery. Starting with the medial compartment of the thigh. Understand this now. Understand this. Answer this MCQ. Yes, perforating branches of deep femoral. Very good. That is profunda femoris. Profunda femoris. Clear. The rest of the arteries we are yet to come across. I'll tell you that. rest of the arteries. Starting with the medial compartment. I have to finish the medial compartment before the break. Okay, we'll start with the medial compartment. A very easy, a very small compartment. Yo, what are the muscles in the medial compartment known as? I'll start. Have a look. The medial compartment is also known as the adductor compartment. Adductor, because it is going to pull the thigh medially. So that's an adductor compartment, and all these adductors also turn the thigh inwards. What's this? Medial rotation. So what is this? What are these group of muscles doing? They do adduction and they do medial rotation at the hip joint. Now, which are these muscles here? Just have a look. Understand this first. Don't write anything. Don't draw anything. Okay, I'll start. Now, there's one muscle here. Start. Adductor longus. Behind the adductor longus is a small muscle, adductor brevis. Behind the brevis is a big muscle, adductor magnus. So, adductor longus, behind it is brevis, behind it is magnus. If you see in a side view, adductor longus, then brevis, then magnus. There's a thin and slender muscle on the medial side, a thin and slender muscle named gracilis. I told you this, gracilis, a thin and slender muscle. There's half of a muscle whose half is supplied by femoral nerve. Yes, which muscle was that? Pectineus. Remember, pectineus, which half was supplied by femoral nerve? Lateral half. So which half is left for us? Medial half of pectineus. And there's one more muscle, obturator externus. So what are the muscles in the medial compartment? Just understand the muscles, then you see the slides. 1. Adductor longus, adductor brevis, adductor magnus, gracilis, pectineus, and obturator externus. Which is the nerve of this compartment? Obturator nerve. Fine. Starting here, just have a look now. Understand the slides. See, you have to be very clear with your theory part. Slides, only then you'll be able to identify. Starting here, have a look. That's the medial compartment of the thigh. Here, what is this muscle? The first muscle here. We've cut this muscle, otherwise this would be the muscle here. What's this? Adductor longus. Now we cut the adductor longus. We remove this adductor longus here. That's adductor longus which is cut here. What is this now? Adductor brevis. Behind the adductor brevis is what? Adductor magnus. There's a thin and slender muscle here. What's that? Gracilis. What is this muscle which arises from this bone? What is this bone? Pecten pubis. And what is this muscle here which is cut here? This is the pectineus. We've cut the pectineus here. Look, we've cut the pectineus. This is pectineus. And if you cut the pectineus, the muscle deep to the pectineus, you can see this muscle. This is the obturator externus. Here, we can't see the obturator externus. Normally, we can't see the obturator externus. Who's going to cover the obturator? Here, what is this muscle? Pectineus. That's pectineus. We cut the pectineus, and deep to the pectineus is obturator externus. Clear? So look here, what are the muscles once again? Adductor longus, we have cut. This is adductor brevis. This is adductor magnus. This is gracilis. This is pectineus, and we cut the pectineus. This is obturator externus. Now, which is the nerve of this compartment? Nerve is obturator nerve. Look at this slide, one moment. Look at this slide. What is this muscle here, like this, which is cut here? What was this muscle? This is adductor longus, right? This is adductor longus. We've cut the adductor longus. What is this now? Adductor brevis. What is this now? Adductor magnus. This is the gracilis. Yeah, there was a muscle here, pectineus. We've cut the pectineus, and what is this? Obturator externus. Fine. Now, which is the nerve of this compartment? The nerve is obturator nerve. Look at this slide now. Sorry. Tell me, obturator nerve. Obturator nerve is a branch of, answer this now. Obturator nerve is a branch of which plexus? Lumbar plexus. Obturator nerve is a branch of lumbar plexus. It is formed by ventral divisions of ventral rami of L2, L3, L4. Look. What is common in femoral and obturator? What is common in both of them? Ventral ramus is common because plexus is formed by ventral ramus. So ventral ramus of L2, 3, 4. Ventral ramus of L2, 3, 4. This is common. For femoral, it is dorsal divisions For obturator, it is ventral divisions. So how do we say that? The dorsal divisions of the ventral rami of L2, L3, L4, that's femoral. The ventral divisions of the ventral rami of L2, 3, 4, that's obturator. Am I clear to all of you? So obturator is a branch of lumbar plexus. It is formed by the ventral division of the ventral rami of L2, 3, 4. Obturator nerve, where was it with respect to psoas major? I just shown you that. It is medial to the psoas major. Now this obturator nerve comes here. What is this part of the sacrum? You know this. This is the ala of the sacrum. Ala of the sacrum. That's the obturator nerve. Obturator nerve is related to the ala of the sacrum. Remembering this, SLIO. O is obturator nerve. Now this obturator nerve, where is it now? Backside. Ala is backside. What is the exit for obturator nerve? The exit is right in front. It's right in front. What's that foramen here? Obturator foramen. Look, obturator nerve is here. Ala is backside. Where is the obturator foramen? It's right in front. The nerve would have come straight like this. No, the nerve would have come straight like this. Straight. And it would have got out through obturator foramen. But no. The nerve cannot do like this. The nerve cannot do this. The nerve cannot come straight like this because there are organs here. Organs. And there are ligaments of this organ. So the nerve cannot cut through the organs. So what does the nerve do now? The nerve winds around the walls of the pelvis. Look. The nerve winds around the walls of the pelvis and here it comes out like this. It goes around the walls of the pelvis and then it comes out. It cannot go straight like this. So what does the nerve do? It goes around the walls of the pelvis and then it comes out and then it gets out through the obturator foramen. And look, this is so nice. As the nerve is winding around the walls of the pelvis, there's someone here to which it is related to. If you can just answer, what's this? What is this? There's an organ on both the sides here. That's the ovary. And as the obturator nerve is winding around the pelvic walls, it forms the lateral boundary. It is laterally related to the ovary. There's a fossa here. This is the ovarian fossa. And the obturator nerve forms the lateral boundary of ovarian fossa. This I'll show you later when I'm showing you the ovarian fossa in the pelvis. Okay. So obturator nerve forms the lateral boundary of the ovarian fossa. Clear? Obturator nerve gets out through the obturator foramen, divides into an anterior and a posterior division. Right? Anterior division. This is anterior and this is posterior. Anterior division lies between what and what? What is this? Adductor longus. This is adductor brevis. So anterior division lies between adductor longus and brevis, and the posterior division lies between adductor brevis and adductor magnus. So this is adductor longus, adductor brevis, adductor magnus. What is this now? Anterior. And what is this? Posterior division. Anterior division lies between longus and brevis. Posterior division lies between brevis and magnus. Clear to all of you, no? That's obturator nerve. It's very easy. You've seen the muscles. You've understood the muscles. You understood the nerve, obturator nerve. You've understood the pores of the obturator nerve. Okay. Very nice. So medial compartment of the thigh, you just need to know this. Starting with obturator nerve. Starting with medial compartment of the thigh, starting with obturator nerve. It is very nice. Understand all these things. Anatomy is very interesting. Obturator nerve, start. Branch of lumbar plexus. Branch of lumbar plexus formed by ventral divisions of ventral rami L2, 3, 4. Just be with me, write with me. Branch of lumbar plexus formed by the ventral division of ventral limb of L2, 3, 4. These are all very important relations. These are all very important MCQs related to ala of the sacrum forms. So anything about obturator nerve comes, you're perfect with it. Forms the lateral boundary of ovarian fossa. So now you know the lateral boundary of ovarian fossa, obturator nerve. You know the relations of ala of sacrum. Emerges out through obturator foramen. Emerges out through the obturator foramen. Femoral triangle is in the anterior compartment. Yes. Emerges out through the obturator foramen and divides in two. Understand the course as you're writing now. Just try to visualize the course of obturator nerve. Anterior division, posterior division. Anterior division lies between adductor longus and brevis, lies between brevis and magnus. I'm writing it shorter. Supplies adductor longus, adductor brevis, gracilis, medial half. Supplies adductor magnus, obturator externus, obturator externus. If anything is not clear in writing, you tell me. Divides into anterior and posterior division. Anterior division lies between longus and brevis. Posterior division lies between brevis and magnus. The anterior division supplies adductor longus, adductor brevis, gracilis, pectineus medial half. Posterior division supplies adductor magnus and obturator externus. Am I clear to all of you? Where is the obturator externus? It is at the obturator foramen. It arises from the obturator foramen. And where is this obturator externus? We are not able to see this obturator externus. You have to cut the pectineus. And if you cut the pectineus, you open the pectineus. Deep to the pectineus lies the obturator externus. Obturator externus. Okay, I'll show you that slide. I'll show you. Actions of all these muscles. I'll show you the slide, just one moment. I will finish this. Actions, adduction and medial rotation. Adduction and medial rotation at the hip joint. Adduction and medial rotation at the hip joint. All these muscles are going to act, all these muscles will get inserted on the femur. So they will act only on the hip joint. Now gracilis also crosses the knee joint, no? Gracilis also causes flexion and medial rotation at the knee joint. anti-rapist muscle. Only one exception, obturator externus. Causes lateral rotation. I'll tell you how this is. Okay, so action is adduction and medial rotation at the hip joint. All of them, they will do adduction and medial rotation. Gracialis in addition, because gracialis crosses the knee joint also. So what is the action of gracialis on the hip, on the knee? It does adduction and medial rotation at the hip joint. On the knee joint, it does flexion and medial rotation. Gracialis is therefore known as an anti-rapist muscle. So this is it. Only one exception is obturator externus. I'll show you that obturator externus. If you're done, tell me. I'll tell you. It is inserted into the trochanteric fossa. Yes. Obturator nerve gives branches to the hip joint as well as knee joint. Both hip joint as well as knee joint. It gives articular branches. Okay, clear to all of you? So that's about the medial compartment. Just see the slides, it will be clear to you. Just one moment. Okay, done. See the slide. Yo, that's it. See the slide. Oh, one moment. See the slide now. Yo, what is this muscle? Look at the muscle once again. Fast, be quicker now. What is this muscle here? The first muscle. What is this? Adductor longus, right? This was adductor longus. You've cut the adductor longus. What is this now? Adductor brevis. Deep to the adductor brevis is adductor magnus. What is this muscle? Gracialis. What is this that I'm pointing? This is the anterior division of obturator nerve. Anterior division lies between adductor longus and adductor brevis. And what am I showing you now? That's the posterior division of obturator nerve lies between adductor brevis and adductor magnus. Clear to all of you? Okay. Now there was a muscle here which was inserted like this going back here. What was that? This was the pectineus, which was beginning from the pecten pubis. The moment we cut the pectineus, what is this muscle here? This is the obturator externus. Now what is the origin of obturator externus? It begins from the obturator foramen and it is going backside. It is getting inserted into, look, you tell me now, what is this for the femur? Greater trochanter, right? Who's behind your behind on this side, backside? That would be the lesser trochanter. What is this line known as? This is the intertrochanteric line. And backside, if you go backside, you have an intertrochanteric crest. And there's a fossa there, trochanteric fossa. So where is the insertion of obturator externus? It is going backside and it will be inserted into the trochanteric fossa. And now you tell me, when this muscle contracts towards its origin, what is it going to do? It will turn the femur outwards, and this is lateral rotation. Am I clear? So what is the action of obturator externus? It is the only muscle in the medial compartment which is going to do lateral rotation. The only muscle in the medial compartment which does lateral rotation is obturator externus. Is this clear to all of you? Because it is going backside. Now it is going backside. So when it contracts, it is going to do what? It is going to laterally rotate. Lateral rotation. Okay, that's it. So that's about the medial compartment of the thigh. Understand this now. Posterior compartment. I'll just start with the posterior compartment. I'll give you an idea of the posterior compartment. Okay. Have a look at the slides. 11:30 will take a break. I'll just start with the posterior compartment. Origin is from obturator foramen. Obturator foramen, outside is obturator externus, inside is obturator internus. Now all this, no, fine. Just have a look at this. Posterior compartment of the thigh. Just listen. I'll just give you an idea of the posterior compartment. Okay. Now, what is the group of muscles in the posterior compartment known as hamstring? They are known as hamstring because they support the pelvis on the femur. Hamstrings. Now, which are the hamstrings? Look, half is a muscle, half is a membrane, named semimembranosus. Another, half is a muscle, half is a tendon. What's that? Semitendinosus. A muscle which has got two heads. Biceps femoris. That was biceps brachii. This is biceps femoris. And there's one more muscle named adductor magnus. Now, adductor magnus lies in the medial compartment also. Adductor magnus also lies in the posterior compartment. Adductor magnus in the medial compartment was supplied by whom? The posterior division of obturator nerve, and adductor magnus in the posterior compartment would be supplied by sciatic nerve. Which is the nerve here? Sciatic nerve. So adductor magnus would be an example of what? Composite muscle. Clear now? So composite muscles would be one pectineus, I've told you. Second one would be adductor magnus. Just wait, listen to this. I'll be telling you this again. So clear which are the muscles here? One semitendinosus, semimembranosus, biceps femoris and adductor magnus. These are the muscles. Just listen first. Now, when do we call the muscle as hamstring? Hamstring. What is the criteria to call the muscle as hamstring? Criteria for hamstrings. When do we call the muscle as hamstrings? 1 minute. Origin. Origin of all these muscles is what? Ischial tuberosity. Look at that. All these muscles will arise from ischial tuberosity. Posterior compartment, hai na? So all these muscles will arise from the ischial tuberosity. Insertion. These muscles will cross the hip joint. They will cross the knee joint. That means where will they be inserted on? Tibia or fibula. Tibia or fibula. So insertion is tibia or fibula. Origin ischial tuberosity. Insertion tibia or fibula. What is the nerve supply for all these muscles? Sciatic nerve. Now, sciatic nerve is made up of two components, two parts, a tibial part and a common peroneal part. So, which part of sciatic nerve? The tibial part or the tibial component of the sciatic nerve. And all these muscles are backside. So, what are they going to do to the hip joint? They'll take the thigh back. So, what will they do? Extension at the hip. And they will cross the knee also. So what are they going to do? Flexion at the knee joint. So all these muscles will do extension at the hip and flexion at the knee joint. If a muscle is going to satisfy this criteria, we call this muscle as a hamstring. Okay. Origin, insertion, nerve supply, action. If it satisfies this, it is a hamstring. If it doesn't even satisfy one criteria also, we do not include it in the hamstrings. Okay. We'll start with this. Posterior compartment of the thigh. It's an easy compartment. Just understand this and write. Okay, starting with posterior compartment of the thigh. Posterior compartment. We'll start with the muscles. Semimembranosus. Semitendinosus. biceps femoris. Adductor magnus. Ischial head. Ischial head of adductor magnus. The ischial head matlab the one which arises from ischial tuberosity. Ischial head. Criteria for hamstrings. Origin ischial tuberosity. Insertion tibia or fibula. Nerve supply. Tibial part of sciatic nerve. Tibial part of sciatic nerve. Action. Extension at the hip joint. Flexion at the knee joint. Extension at the hip, flexion at the knee joint. Your concept should be very clear. Okay. So when this is when we call the muscle as hamstring. Fine, no? Okay, clear to all of you? Now see this and you tell me, answer this. Look at, that's the femur here. That's the tibia here. That's the fibula here. Femur, tibia, fibula. Okay, that's a medial condyle, that's a lateral condyle. This is a medial supracondylar ridge, lateral supracondylar ridge. Okay. On the medial supracondylar ridge, what is this, if you can answer? What is this and why is this so important? On the medial supracondylar ridge, you get a tubercle here, named adductor tubercle. This is adductor tubercle, and why is this so important? If you can tell me, why is this adductor tubercle so important? Because there's someone who is attached to this adductor tubercle here. This muscle attached to the adductor tubercle is adductor magnus. Adductor magnus. Okay, now understand this now. Where is the adductor magnus inserted? Look, adductor magnus is inserted on the femur, on the adductor tubercle of femur. Adductor magnus is inserted on the adductor tubercle of femur. Fine. What was the criteria for hamstring? What was the criteria? It should be inserted in tibia or fibula. It should be attached to tibia or fibula. Now, adductor magnus is inserted on the femur. So, adductor magnus does not satisfy the criteria for hamstring. You are understanding this? But still, that means adductor magnus should not be included in the hamstrings, right? But still, we include this adductor magnus in the hamstring. There's a reason for that. What is the reason for that? Look, the reason for this. Long ago, adductor magnus was inserted on the tibia. Look, long ago means in ancestors. Long ago, in ancestors, adductor magnus was inserted on the tibia. It was inserted on the tibia to begin with. But in due course of time, as evolution has progressed, this much part of adductor magnus between the tibia and the femur is got degenerated. It's got degenerated. Now in us, if you see this is seen in the form of a ligament here. This is seen in the form of a ligament in us. A ligament which extends from, look at this, a ligament which extends from the tibia to the femur. Look at that. A ligament which extends from the tibia to the femur to the tibia, and this is what we call as the tibial collateral ligament or the medial collateral ligament. That means tibial collateral ligament is a degenerated part of what? adductor magnus. This is extremely important. Am I clear to you? So tibial collateral ligament is a degenerated part of adductor magnus, and that is why even though adductor magnus is inserted on the adductor tubercular femur, still we consider this adductor magnus as a hamstring, because this represents the degenerated part of adductor magnus, right? So there are many such degenerated parts. What is this? Fibular collateral ligament, huh? And that's a degenerated part of something. I'll tell you this. Collateral ligaments. This you need to know. Okay, we'll start. Just write down. Just the degenerated parts I'm telling you. We'll finish this much. Tibial collateral ligament. Tibial collateral ligament is a degenerated part of very important MCQs, adductor magnus. Degenerated part of adductor magnus. Fibular collateral ligament. Degenerated part of peroneus longus. I'm telling you all the degenerated parts. You need to know this. Fibular collateral ligament is a degenerated part of peroneus longus. Oblique popliteal ligament is a degenerated part of semimembranosus muscle. Oblique popliteal ligament is a degenerated part of semimembranosus muscle. Semimembranosus. Okay. And look here now. Look here. Understand this. This was an MCQ which was asked. Have a look. Now, there was a muscle which was beginning from the sacrum here. Look. A muscle which was beginning from the sacrum, and this muscle goes to the ischial tuberosity, and from the ischial tuberosity it goes in the thigh, in the posterior compartment of the thigh. What is this long muscle known as? The long head of biceps femoris. This is the long head of biceps femoris. So the long head of biceps femoris was arising from where? Sacrum. Goes to the ischial tuberosity and then further goes down into the thigh. Now, as evolution has occurred, as evolution has progressed, this much part of the long head is become a ligament. Look, this part, the long head of biceps extending from the sacrum to the ischial tuberosity, has become a ligament. And now if you see, where does the long head begin from? Ischial tuberosity, and this represents the degenerated part of the long head of biceps femoris, and this is what we call as the sacrotuberous ligament. Sacrotuberous ligament, clear? So sacrotuberous ligament represents the degenerated part of long head of biceps femoris. And what is this? Sacrospinous ligament, that I'll tell you. So just continue. Oblique popliteal ligament is this semimembranosus sacrotuberous ligament. That's a degenerated part of long head of biceps femoris. Long head of biceps femoris. Tibial collateral ligament is adductor magnus, man. Adductor magnus. Okay. So sacrotuberous ligament is long head of biceps femoris. Now tell me. Look, we had a tail first. Tail. And which is the muscle which goes in the tail? The tail is very strong. You know, the animal hits with the tail. The tail is very strong. Which is a muscle going in the tail? Coccyges. When our ancestors, when they used to stay on the trees, they used to put the tail around the tree and jump from one tree to the other tree like that. So the tail is very strong. As the ancestors came down and started walking on two legs. Look, when we walk on four legs, when we walking on four legs, the tail is automatically up in the air. Now when the ancestors came down and started walking on two legs, then the tail used to rub against the ground, and every time they used to walk like this, every time the tail used to rub against the ground, very uncomfortable it was, every time the tail rubbing against the ground. So they had to lift the tail and walk like this, so the tail doesn't rub against the ground. And gradually the function of the tail went off. The tail now become a ligament. The muscle now got converted into a ligament. This is the sacrospinous ligament. And what muscle does it represent? Coccygeus. Coccygeus. Understood? So that's sacrospinous. Sacrospinous ligament. Coccygeus muscle. Coccygeus muscle. So sacrospinous ligament represents a degenerated part of coccygeus muscle. So these are all the degenerated parts of the muscle. Yes. Clear to all of you? So these are the degenerated parts. Be very, very, very clear about this. This is very important. And you remember, I told you a detached part of the muscle. These are the degenerated parts of the muscle. I told you a detached part of a muscle, if you remember that. Detached part. Long ago. Detached part of a muscle. Detached part of a muscle. You should be able to correlate like this. What was that? Anconeus. Yes. Anconeus is a detached part of what? These are degenerated parts, and anconeus is a detached part of, you are able to recollect, medial head of triceps. Anconeus is a degenerated part of the medial head of triceps. Why? Because the same nerve which supplies the medial head also goes and supplies the anconeus. So that's how it's a degenerated part of the medial head of triceps. This is clear to all of you. That's about the medial compartment. Just 2 minutes. Fine. But still, one muscle is definitely not a hamstring. Look, there are two heads of biceps now. The long head is a hamstring. The short head of biceps is definitely not a hamstring. Why? Just like this point, then we stop. Short head of biceps is not a hamstring. Short head of biceps is not a hamstring, as arises from linea aspera of femur. Linea aspera is on the posterior surface of the femur. You get an elevation like this. That's linea aspera. Arises from linea aspera of femur, supplied by common peroneal part of sciatic nerve. Supplied by common peroneal part of sciatic nerve. You understanding? What are the hamstrings supplied by? Tibial part of sciatic nerve. Whereas short head of biceps doesn't arise from the ischial tuberosity. It arises from the femur. That's point number 1. Second, it is supplied by the common peroneal part of sciatic nerve. The hamstrings were supplied by tibial part of sciatic nerve. So that is why this is not a hamstring. Nerve supply of hamstring is tibial part of sciatic nerve. We've written now tibial part of sciatic nerve. I'll just make one slide. 2 minutes. I'll just make one slide and then we'll stop. Just 1 moment. Just make one slide. So that will complete this compartment. Okay. Okay, fine. Just have a look. See you. I'll just insertion. I'm telling you. Look, just a diagrammatic representation. That's the ischial tuberosity. If this is lateral and this is medial, this is supralateral, this is supromedial. Just 1 moment, don't write. Infralateral and infromedial. supromedial. Just remember the slide, everything will be clear to you. Now what arises from the supralateral aspect? What arises from the supromedial will start. This is semi-tendinosus and biceps femoris. Semi-tendinosus, biceps femoris. Supralateral aspect, what arises is semi-membranosus. What arises from the infralateral aspect is, one moment, I'll just adductor magnus, and the inframedial aspect is nothing here. There's a bursa here, bursa. There's a bursa on the, this is the ischial tuberosity I've drawn this ischial tuberosity, and we divide the ischial tuberosity into 4 quadrants: superior, inferior, lateral, medial. So this is supralateral, supromedial, infralateral, inframedial. So what arises from the supromedial aspect is semitendinosus and the long head of biceps femoris. Supromedial aspect. Supralateral is semi-membranosus. Infralateral is adductor magnus. Inframedial, there's a bursa. There's nothing there, there's a bursa. And you know, we are sitting on this bone, we are sitting right on the medial aspect of ischial tuberosity. But we never feel that we're sitting on a bone. Why? Because there's a bursa here. And if we sit for a long time, we get bursitis over the ischial tuberosity. And this is what we call as weaver's bottom, or tailor's bottom, or student's bottom. That's bursitis over the ischial tuberosity. Weaver's bottom. Now see here, this semi-membranosus comes on the medial side. I'll just draw this slide and we'll stop her. Semi-membranosus comes on the medial side. Biceps femoris goes on the lateral side. That's on the lateral side. Semi-membranosus comes on the medial side. Semi-membranosus comes on the medial side. That's a short head of biceps. Short head of biceps femoris. And I'll make this as adductor magnus. Adductor magnus. Just 2 minutes, I'll finish the slide, 2 minutes. And what is this muscle now? This is the gastrocnemius. Gastrocnemius. And this becomes the popliteal fossa. And what are these branches? You remember this? These are the perforating branches of profunda femoris. And what is this artery which has come here? That's a popliteal artery and popliteal vein. And what is this opening known as? I can't put everything on the same slide, just 2 minutes, I'll show you. What is this opening known as? Hiatus magnus. Hiatus. Okay, so that's about my slide. I'll label this for you. Supromedial is semitendinosus. Yes, semitendinosus and biceps femoris. Semitendinosus and biceps. I'll label that. I'll label that for you. That's semi-membranosus. That's a long head. I'll write the insertions here so it will be easy. Okay, you're following this one now? Biceps femoris long head है ये. This is long head. I've labeled it. Look now, I have this long head. This is short head. These are the perforating branches of profunda. Perforating branches of profunda. Okay, and this is adductor magnus. Inserted on. So this will do a complete view. Inserted on the medial inserted on the medial aspect of shaft of shaft of tibia. Inserted on the medial aspect of shaft of tibia. Okay, so this gives a complete orientation. Adductor magnus is infralateral. Adductor magnus is infralateral. Supralateral is this. Person name I'll tell you later. I'll tell you that later. Supralateral semimembranosus. I'll write it here for you if it's not clear. Supralateral is adductor magnus. It should be clear now. Name of the bursitis is Weaver's bottom, Taylor's bottom, or student's bottom. Weaver's bottom, Taylor's bottom, or student's bottom. Weaver's bottom, Taylor's bottom, student's bottom. I'll be telling that later. Don't worry. What I've written, what I've drawn, just draw that. I'll be telling you that later. Don't worry. Who inserts on the medial condyle? Okay, clear to all of you? Biceps femoris is inserted on the head of the fibula. Biceps femoris is inserted on the head of fibula. Yes. Yes, yes. So I've told you the insertions also, I've told you the origin also, so you get an idea, complete idea now of the hamstrings. This should be perfect. Hamstrings are extremely important muscles. This is clear to all of you? Yes? See the slide? So that completes the... Okay. Just have a look. It's 2 minutes. See the slide, sir. We'll stop here, huh? 2 minutes. We'll stop here. Okay, done. To all of you, clear. Now see if you get a visual like this. Now you're clear with the theory part. Just see the slides now. If you get visual like this, huh? Look. Now, first see which is lateral, which is medial. Just 2 minutes, just 2 minutes. Tell me which is lateral, which is medial here. This is lateral here, this is medial here. Fine. That's the ischial tuberosity, right? So now you tell me what is this muscle? This is the biceps femoris, long head. And then what would this be? This would be the biceps femoris, short head, right? And where will be it inserted on head of the fibula? What is this muscle? This one. This is semitendinosus. What is this muscle? This is semimembranosus. And what is this muscle? Look at that. This is the adductor magnus. Adductor magnus. And what are these? These are the perforating branches of profunda femoris. right? These are the perforating branches of profunda femoris. Clear? Biceps is inserted on the head of fibula. This is the gastrocnemius, lateral head, medial head. This is the popliteal fossa, right? And this is the hiatus magnus, and these are the popliteal vessels. Yes, clear now? So popliteal fossa is also clear. I don't explain that separately. Popliteal fossa, supralateral boundaries formed by whom? Biceps femoris. The supromedial boundaries formed by whom? Semitendinosus, semimembranosus. Infralateral boundaries formed by lateral head of gastrocnemius. The inframedial boundaries formed by the medial head of gastrocnemius. And the contents would be the popliteal artery, the popliteal vein, the sciatic nerve with the tibial and the common peroneal nerves. Tibial and common peroneal nerves. That's how it is. Okay, clear to all of you? This is the slide. So that's about the posterior compartment. Lower limb is very easy to understand. I told you, you just have to understand the muscles, vessels and nerves. There's nothing else there. That's it. Clear? You take a break then. Adductor magnus is inserted on the adductor tubercle of femur. Adductor magnus is inserted on the adductor tubercle. No, I told you. Okay. Clear? You take a break. 12 o'clock I'll start. 12 o'clock. Adductor magnus we have written. No. Inserted on the adductor tubercle of femur. Okay, it's not on the tibia. Clear? Fine. Take a break. 15 minutes will start. Okay, fine, thank you. 15 minutes at 12 o'clock I'll start. Okay. With this now, clear with this now? Clear with the compartments of the thigh. Okay, we'll start with the gluteal region. Understand this. Another very important topic is gluteal region. Now, what is this muscle here? This muscle is the gluteus maximus. That's the gluteus maximus here. This is the gluteus maximus muscle. A very important MCQ. Gluteus maximus. What is the origin of this muscle? One moment, I'll just see the slide. Have a look at this slide. Yep, I'll start. I can't magnify it much. Okay, this is fine. I'll start. Have a look. Starting with the gluteal region. Starting with gluteus maximus. Now, what muscle arises from here? What is the muscle which was arising from here? This is the iliac fossa. And what was the muscle here? Iliacus. What am I drawing here for you? What is this that I have drawn here? This is the inguinal ligament. This is the inguinal ligament. And clear now? If that's the inguinal ligament, this is the bone here. And what is this space known as? This is the pelvifemoral space. That's the pelvifemoral space, right? So this is the inguinal ligament here. And this is the pelvifemoral space. And all the structures from the pelvis were passing through this space. And where would they enter into femoral region? Right. So this muscle is the iliacus muscle here. That's the iliac fossa. Now, what is this for the hip bone? What is this for the ilium? This is known as the gluteal surface of ilium. Gluteal surface. Just understand. We draw three lines here. One is the inferior gluteal line, one is the anterior gluteal line, and one is the posterior gluteal line. Inferior, anterior, and posterior divides this gluteal surface into three parts. There are muscles attached here. One is the gluteus maximus, this is the gluteus medius, and this is the gluteus minimus. Gluteus maximus, medius, minimus. Okay, so now starting with gluteus maximus, just understand this. Gluteus maximus arises from the gluteal surface of ilium behind the posterior gluteal line. Behind the posterior gluteal line arises from the sacrum and the coccyx. Sacrum and the coccyx. The sacrotuberous ligament. Sacrotuberous ligament. So this is a big muscle. This is a big muscle. That's gluteus maximus. And where is the insertion of gluteus maximus? This entire gluteus maximus comes and gets inserted into the tract there. The tract on the lateral side. What was that? Iliotibial tract. So major part of gluteus maximus is inserted into the iliotibial tract. Adductor, the medial compartment muscles and they arise from this bone, this part, the istiopubic ramus. This is where the adductor longus brevis magnus, the medial compartment muscles will arise from. That is the istiopubic ramus. Clear, no? I've just started. See here once again. This is the gluteal surface of ilium. Once again, I'm telling you, the gluteal surface of ilium is divided by an inferior gluteal line, anterior gluteal line, and a posterior gluteal line. Three muscles. This is maximus, this is medius, and this is minimus. So what is the origin of gluteus maximus? It arises from the gluteal surface of ilium behind the posterior gluteal line, the sacrum and the coccyx, the sacrotuberous ligament, and this entire gluteus maximus is inserted into the iliotibial tract, and it is also partly inserted on the femur. Partly onto the femur it is inserted. Just one moment, I'll show you the slide. Have a look at this slide. See this slide. That's the gluteus maximus. What is this tract here? That's the iliotibial tract, and it is also inserted on the femur. Now tell me, what is the action of gluteus maximus? Look, origin is here, insertion is on the lateral side. When this muscle contracts, it takes the thigh backwards. What is that? Extension. It is a very powerful extensor. Any other muscles which are extensors of the hip joint? The hamstrings. The hamstrings are also extensor. Gluteus maximus is a very powerful extensor. Hamstrings also do extension. So now you tell me, when does this gluteus act and when does the hamstring act? Both of them do extension. So when we normally walking, this is done by whom? Hamstring. And when there's an anti-gravity movement, anti-gravity meaning you're standing up from a sitting position, or when we are climbing stairs, this is anti-gravity, and this is done by whom? Gluteus maximus. It's a very powerful anti-gravity muscle. Okay. So what is the main action of gluteus maximus? The main action is extension at the hip joint. Now origin is here, insertion is on this side. So when it contracts, it turns the thigh like this, outwards. What's that? Lateral rotation. It will do lateral rotation at the hip joint. And this fibers, you see this fibers, the upper fibers, when they contract, what will they do? They'll take the thigh outwards, upwards. So what is that? Abduction. So what is the main action of gluteus maximus? 1. Extension. 2. Lateral rotation. And 3. Abduction at the hip joint. What is the nerve supply of gluteus maximus? The nerve supply is inferior gluteal nerve. Clear to all of you? So that's about the gluteus maximus. This is a very important region, the gluteal region. Starting with this, gluteus maximus. Okay, sure. Be with me. Write down. Starting with gluteus maximus. Gluteus maximus, origin, gluteal surface of ilium, behind gluteal region. Topic is gluteal region. No? Gluteal surface of ilium behind the posterior gluteal line. Gluteal surface of ilium behind the posterior gluteal line. Sacrum and the coccyx. Sacrotuberous ligament. Gluteal surface of ilium behind the posterior gluteal line, and just one more, dorsal aspect of iliac crest. The iliac crest we have now on the dorsal aspect. So gluteal surface of ilium, and we go above that, that will be the iliac crest. So that's the origin of gluteus maximus. Insertion, iliotibial tract, gluteal tuberosity of femur. One is the iliotibial tract and the second is the gluteal tuberosity of femur. Nerve supply inferior gluteal nerve. Action, extension, lateral rotation and abduction. Extension, lateral rotation and this is a gluteal region actually. Gluteal region. It begins from the pelvis and it is inserted, it begins from the gluteal surface of ilium inserted on the femur. Clear? So extension, lateral rotation and abduction at the hip joint. This is clear to all of you? So that's about the gluteus maximus. Be very clear with this muscles. Be very clear. These are very important MCQs. And now just have a look at this slide. See this slide and try to understand this slide. A very important visual slide. Many times it has been asked in the DNBs and all. Okay, we'll start. Here we are. What is this big muscle here? That's the gluteus maximus. We've cut the gluteus. See, this is the gluteus maximus. It's a very big muscle, like this it was. This was how the gluteus maximus is. So we've cut the gluteus maximus. We've opened the gluteus maximus. What is this muscle here now? What is this muscle? This is the gluteus medius, like that. That's the gluteus medius. The gluteus medius is like this. And what is this muscle here? This is the gluteus minimus. Gluteus minimus. So gluteus medius is inserted on the lateral aspect of the greater trochanter. Lateral aspect. And gluteus minimus goes in front. Anterior aspect of greater trochanter. Just try to understand this, gluteus medius and minimus. I'll just try to explain you on a full screen. Have a look at this slide and just one moment, I'll call someone so that it will be easy to understand. One moment. Okay, understand this now. Gluteus maximus. What was the origin of gluteus maximus? Clear? And where is the insertion of gluteus maximus? This is clear to all of you. Now, gluteus medius would arise from the gluteal surface of ilium and the between the anterior and the posterior gluteal line. And gluteus minimus would be further in front. Now, just understand this. See here. This is the hip bone. Okay, just one moment. Here, this is fine. Here, this number. This is the hip bone. This is a pelvis. That's a pelvis, like this pelvis. And this is the action is very important here. That's a pelvis, and this is the pelvis, and this is the femur. Just imagine that's the femur here. That's the femur. And that's a hip bone, that's a femur. Now, gluteus medius begins from this hip bone, and the gluteus medius is inserted on the femur. That's the greater trochanter here. So, gluteus medius would begin from the hip bone. It is inserted on the lateral aspect of the greater trochanter, lateral aspect. It's exactly at the right angles to this hip joint. Starts from the hip bone and is inserted on the lateral aspect of the femur. It's exactly at right angles to this hip joint. And actually, when any muscle is at right angles to a joint like this, who was this? Deltoid. What does it do? It takes the joint outwards. What is this? Abduction. So gluteus medius is exactly at right angles. This is the pelvis like this. That's the femur. That's the femur. So begins from the hip bone, gets inserted on the lateral aspect of the greater trochanter. When this muscle contracts, what will it do? It will take the femur upwards. What is this? This is abduction. Abduction at the hip joint. So gluteus medius is a very powerful abductor. And understand this, gluteus minimus begins from the hip bone and goes and gets inserted on the anterior aspect of the greater trochanter. anterior aspect of the greater trochanter. Starts from here, goes in front. When this muscle contracts upwards, what does it do? It turns the femur inwards. Inwards, what's that? Medial rotation. Understand this, and this is slightly difficult. So what is the action of gluteus medius? Abduction, and minimus would be medial rotation at the hip joint. Now, this is when a muscle acts from origin to its insertion. It does abduction and medial rotation. Now, the same gluteus medius and minimus can act from insertion to its origin. So now you tell me, when they act from insertion to its origin, what will they do? Look, understand this now. I'm standing on two legs. The pelvis is supported on both the sides. Right? If I lift my one foot off the ground, I take my one foot off the ground. Suppose if I'm standing on both the legs, I take my right foot off the ground. The pelvis will fall to which side? Right side. I take my right foot off the ground, so the pelvis will fall to the right side. But this does not happen. Why? This does not happen. The pelvis doesn't fall to the right side because the gluteus medius, and minimus of the opposite side, they're going to contract, and they will pull the pelvis on that side. You're following? Thank you. So now see, if I'm standing on two legs, the pelvis is supported on both the sides. I lift my right foot off the ground. The support on the right side is gone. The pelvis should fall on which side? Right side. But this does not happen. Why? The gluteus medius and minimus of the opposite side, they will contract and they will pull the pelvis on that side. That means when my right foot is off the ground, which glutea are contracting? Left. And when my left foot is off the ground, the right gluteus medius and minimus are contracting. So now, if the left gluteus medius and minimus are paralyzed, now suppose if I lift my right foot off the ground, the pelvis will fall on which side? Right side. If the left are paralyzed, the next step is normal. Again, the pelvis falls to the right side. What is this gait known as? This is known as a lurching gait. Unilateral and a lurching. And if both the glutes are paralyzed, the person walks like a duck like this. What is this gait known as? Waggling gait. So what is the action of gluteus medius and minimus? They support the pelvis when one foot is off the ground. Okay. They support the pelvis when one foot is off the ground. Is this clear to all of you? So that's about the gluteus medius and minimus. This one, and this way is this. Okay, is this clear? Clear? So that's about the gluteus medius and minimus. One moment, I'll just tell him to make the screen proper. The screen is... The screen ठीक कर लो ना, screen ठीक कर लो. Clear? Clear to all of you? Okay. So starting with gluteus medius and minimus. Clear to all of you, no? Okay. We'll start now. So that's gluteus medius and minimus. Actually, we'll start. Starting with gluteus medius and minimus. Wait, let him make the screen proper. Just one moment. Okay. Okay. Just write down gluteus medius and minimus. Just write down gluteus medius and minimus. Gluteus medius and minimus. gluteus medius and minimus. Action. I'll tell you this also. 1 minute. I'll tell you the right. Starting with gluteus medius. Gluteus medius. Medius and minimus, but I'll write medius. Gluteus medius. Chalo, be faster. Origin. Gluteal surface of ilium. Origin. Gluteal surface. Gluteal surface of ilium between the anterior and posterior gluteal lines. Between the anterior and posterior gluteal lines. Gluteal surface of ilium between the anterior and posterior gluteal lines. Insertion. Lateral aspect of greater trochanter. Lateral aspect of greater trochanter. Nerve supply. Superior gluteal nerve. Superior gluteal nerve. Okay, no. What was the inferior gluteal nerve supplying? Gluteus maximus. This is the superior gluteal nerve. Yes. Action. Abduction at the hip joint. Abduction at the hip joint. So that's about the gluteus medius. Now the next is gluteus minimus. Gluteus minimus. Origin. Gluteal surface of ilium. All this I don't tell in the regular batches also. I have told you many things. Otherwise all this gluteus medius and minimus origin and all I don't tell. But that's fine. Gluteal surface of ilium between inferior and anterior. Gluteal line. Gluteal surface of ilium between the anterior and inferior gluteal line. I'll draw that. I'll show that lines once again. Insertion. Anterior aspect of greater trochanter. Anterior aspect of greater trochanter. Now supply. Superior gluteal. No. Now just one thing. Look. You know the branches of lumbar plexus. You know all the branches of lumbar plexus. Like which were the branches of lumbar plexus? No. Not subcostal. No. Not subcostal. Subcostal is T12. Not subcostal. Which are the branches of lumbar plexus? Starting from about onwards. That posterior abdominal wall slide should come to your brain immediately. Iliohypogastric, ilioinguinal nerve, the lateral femoral cutaneous nerve thigh, the femoral, the genitofemoral, and the obturator. These are the branches of lumbar plexus. Now, anything else than this, anything other than this, has to be a branch of the sacral plexus. That's how you remember. It's very easy. Be very clear with the branches of lumbar plexus. Iliohypogastric, ilioinguinal, the lateral femoral cutaneous nerve thigh, the femoral, the genitofemoral, and the obturator. This is lumbar plexus. Anything else other than this, like for example, superior gluteal nerve and vessel nerve, inferior gluteal nerve, the sciatic nerve, the pudendal nerve, all this is going to be the branches of sacral plexus. Easy to remember, because why I'm telling you, if you go above the lumbar plexus, if you go above the lumbar plexus, where are we? In the thorax. So we will be getting the intercostal nerves and the subcostal nerve above that. So that's how you remember. any nerve that you come across other than the 6 nerves would be branches of sacral plexus. That's it. Okay, action, medial rotation at the hip joint. Okay, so see, specifically gluteus medius, if asked specifically, gluteus medius does abduction and gluteus minimus does medial rotation, but both these muscles acting together, they support the pelvis. This is together, both of them. They support the pelvis when one foot is off the ground. Okay, that's it. Okay. Yes, clear to all of you? So acting together, they support the pelvis when one foot is off the ground. Clear to all of you? Yes. So that's about the gluteus medius and minimus. And now see this. This is a very important slide. Now you should be able to identify this. Gluteus maximus actions, I've told you, no? Have a look at this slide now. Just concentrate on this slide. Here I am. Okay, so that's the gluteus maximus here. That's the gluteus maximus. That's the gluteus medius. That's the gluteus minimus. Now, this is a pear-shaped muscle. Look at that. That's a pear-shaped muscle. A pear-shaped muscle, and this is what we call as the KEY, key muscle of the gluteal region. And this pear-shaped muscle is known as what? The piriformis. And this is known as the key muscle of the gluteal region, because the moment we get this muscle, we get everything in this region. Why? Because there are nerves and vessels about this muscle. Remember, there's only one nerve and one vessel about this muscle. What's that? The superior gluteal nerve and vessels. Rest, everything comes below this muscle. That's the inferior gluteal nerve and vessels. This is the sciatic nerve, and all these things I'll be telling you slowly. So this muscle is known as the key muscle of the gluteal region. Now, what is this muscle? This is known as the obturator internus. Obturator internus. Just listen to this. Just listen to this, don't write anything now. Obturator internus. I've told you about the obturator externus. If you remember, obturator externus lies in which compartment of the thigh? Medial compartment of the thigh. And what had we to do to see the obturator externus? We had to cut the pectineus, and once we cut the pectineus, below that was obturator externus. And what was the characteristic of obturator externus? That was the only muscle in the medial compartment that was causing lateral rotation. Remembering that obturator externus. Now this is the obturator internus. Now where this muscle comes from, where it is inserted, I will be telling this in the pelvis. I just want you to be familiar with this muscles. That is why I've started the lower limb first and then the pelvis. So it will be easy for you. So this is obturator internus. Fine. Above the obturator internus, there are two small worm-like muscles. Look, this is one and this is one. What do you call this as? The superior gemellus. And this is the inferior gemellus. Superior gemellus, inferior gemellus. Now, this is a quadrangular muscle, and this is what we call as the quadratus femoris. Quadratus femoris. So see the sequence now. See the sequence. Piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. All these muscles begins from the pelvis, and all these muscles are inserted on the femur, and all these muscles are known as the pelvifemoral muscles. Pelvifemoral muscles. Which are these pelvifemoral muscles? One, piriformis, the superior gemellus, the obturator internus, the inferior gemellus, and the quadratus femoris. And when these muscles contract, they have only one action. They just do one action. They turn the femur outwards. That's lateral rotation at the hip joint. All these details I'll tell you later, where these muscles come from. I just want you to know what is pelvifemoral muscles and which are the muscles included in this category, pelvifemoral muscles. Action of all these muscles would be lateral rotation. Okay, so we'll just write this down. Key muscle of the gluteal region. Following now, all of you? Yes. Key muscle. Key muscle is a very important muscle. Key muscle of the gluteal region. You can give me a reference to this key muscle somewhere else I told you. If you remember this key muscle of something else I told you. Guess and tell me. Key muscle. Pelvifemoral muscles. Key muscle of, fine, pelvifemoral muscles. 1. Piriformis. Piriformis. Wait, I'll tell you. Piriformis. 2nd. Superior gemellus. 3rd. Obturator internus. Inferior gemellus. Lateral rotation of the hip joint. Okay, that's it. So these are the pelvifemoral muscles. Pelvifemoral muscles. Just remember the name of these muscles. Details we'll see in the pelvis. It's very nice to understand this pelvis. Okay, clear? So that's about the pelvifemoral muscles. Now we proceed down. Look here once again. I'll show you this slide once again. Quickly, I'll just go through this. See, this is what I was trying to tell you. Yep, understand this now. Just a quick go through. This is the gluteal surface of ilium, right? That's the gluteal surface of ilium, and there are 3 lines here. This is the inferior gluteal line, that's the anterior gluteal line, and that's the posterior gluteal line. Okay, this is inferior, this is anterior, and that's posterior gluteal line. So what is this muscle here? Gluteus maximus. This is gluteus medius and this is gluteus minimus. So minimus arises between the inferior and anterior gluteal lines. Gluteus medius arises between the anterior and posterior gluteal lines. Clear now? So that's about the gluteus medius minimus. All the muscles here, and now see the slide once again and tell me quickly. Yep, that's the gluteus maximus, that's the medius, that's the minimus. One moment, let it be clear. Okay, now what is this muscle? This is the piriformis, that's the superior gemellus, that's the obturator internus, that's the inferior gemellus, that's the quadratus femoris. Okay, and these muscles are known as the pelvifemoral muscles, and actions of all these muscles would be lateral rotation at the hip joint. Lateral rotation at the hip joint. Clear to all of you? Now we'll start with the leg. Understand this leg now. Starting with posterior compartment. You're clear with the thigh, clear with the anterior, medial, posterior compartment, clear with the gluteal region. Now starting with the leg. Leg is a small topic. Before the lunch I should be able to finish the lower limb. Then after the lunch we'll start with pelvis, perineum, histology, general anatomy. Okay, fine. Okay, chalo, we'll start. Now, the leg has got three compartments. One is the posterior compartment, one is the anterior compartment, one is the lateral compartment. A very, very important topic, the leg. The muscles, the actions of the muscles, the nerves and the vessels. You should be perfect with all these things. And if you're clear with your theory, the slides will be easy to understand. Okay, no? I keep on posting images on the club and all, three-dimensional images and all. Just have a look at them. The images which I've already posted, just have a look. And the more of the slides you see, the more your theory is going to be clear. And certain new things also you'll come to know in that. So we'll start. Starting with the leg, starting with the posterior compartment of the leg. Yeah, I start. Just have a look. Don't write anything. Please don't write anything. Just concentrate on this. You'll understand. Now leg. This goes out of screen. Leg has got three compartments here. One is the posterior compartment, one is the anterior, and one is the lateral. Starting with the posterior compartment of the leg. Okay, this much is fine, no? I can't magnify more than this. Sorry. Okay, let me finish this. Then I'll tell you popliteal fossa. We'll speed up slightly. Okay. Yeah. Okay. So the leg posterior compartments having two sets of muscles. One is the superficial set, one is the deep set. The superficial muscles are starting here, this is the gastrocnemius. The gastrocnemius has got two heads, one is the lateral head, one is the medial head. Incidentally, both these heads of gastrocnemius were forming the inferior boundaries of the popliteal fossa, the infralateral and the inframedial boundaries of popliteal fossa. Remembering that was gastrocnemius. The moment we remove this gastrocnemius, we come to the second muscle here. Look at this. What is this muscle? This is gastrocnemius. We remove the gastrocnemius and that is the soleus. And this is a thin and slender muscle. What is this thin and slender muscle? Like you remember there was a thin and slender muscle here of the upper limb. A small belly and a long tendon. What was that? Palmaris longus. And this is known as the plantaris. Look at this. This is known as the plantaris. So now three muscles we have here. One is the gastrocnemius, one is the soleus, and the third one is the plantaris. Together forms a common tendon here. What's that? Tendoachilles. And this tendoachilles is inserted on the calcaneum. What is the action of this tendoachilles? When it contracts, it takes the foot down. So what is this known as? Plantar flexion at the ankle joint. Plantar flexion at the ankle joint. So this is the action of tendoachilles. So these are the superficial muscles. Just listen, don't write anything. Now coming to the deep muscles. Deep muscle. You know who's a locker of the knee joint? Who locks the knee joint? The muscle which is going to extend the knee joint locks the knee joint. And who was that? Quadriceps femoris. So locker of the knee joint is quadriceps femoris. But there has to be someone who's going to unlock the knee joint. Unlocking of knee joint means it will be the lateral rotation of femur or the medial rotation of tibia. And this unlocking is done by whom? Popliteus. So now deep muscles of the posterior compartment, one would be popliteus. Just listen, popliteus. Now, there's a muscle which arises from the tibia fibula, posterior surface of tibia and fibula and the interosseous membrane. Mainly it arises from tibia. Name of the muscle, tibialis posterior. Tibialis posterior. There's one muscle which causes plantar flexion of the great toe. Plantar flexion of the great toe. It's a flexor. Great toe. Hallux. Hallucis. Long muscle. Longus. Flexor hallucis longus. And there's a muscle which causes plantar flexion of the digits. Flexor digitorum longus. Clear? So the deep muscles would include one, popliteus, tibialis posterior, flexor hallucis longus, and flexor digitorum longus. So these are the muscles in the posterior compartment. Okay, we'll start with this. Be very clear with the muscles, the nerves and the vessels I'll tell you as we proceed. Posterior compartment of the leg. Superficial muscles. gastrocnemius, soleus, plantaris. Gastrocnemius, soleus and plantaris together known as tendo Achilles. Inserted on posterior surface of calcule. Inserted on the posterior surface of calcule. Action: plantar flexion at the ankle joint. Plantar flexion at the ankle joint. Okay, so that's about the posterior compartment superficial muscles. Starting with the deep muscles. First, obliques. Obliques action is unlocking of the knee joint. Obliques unlocking of the knee joint. Next, tibialis posterior. Flexor hallucis longus. Flexor digitorum longus. Plantar flexion and inversion. Why is that inversion? I'll tell you later. All these muscles do plantar flexion. These are the deep muscles. Deep muscles, tibialis posterior, flexor hallucis longus, flexor digitorum longus. All these muscles, they do this plantar flexion, and they also turn the foot inwards. That's inversion. They are on the medial aspect of the ankle joint. They are on the medial aspect. So when they contract, they do what? Inversion. The muscles which are on the lateral aspect of the ankle joint, when they contract, they do what? Eversion. So these muscles will be doing plantar flexion and inversion. I'll tell you one moment. Just write this down. Nerve supply, tibial nerve. For all these muscles are tibial nerve and artery, posterior tibial artery. How this nerve, how this artery comes here, I'll tell you after some time. So the nerve, this compartment is tibial nerve, and the artery of this compartment is posterior tibial artery. Now how they come there, I'll tell you after some time. For all the muscles, superficial and deep muscles, for all the muscles. Nerve is tibial nerve, artery is posterior tibial artery. Okay, clear to all of you? Now I'll just make a slide for you. Have a look at this slide. That's the tibia, that's the medial malleolus, that's the fibula here, that's the lateral malleolus. Okay. This is the posterior view. Posterior, you're looking from back side. This is the soleal line. Soleal line, this gives origin to soleus. Fine. What is this muscle inserted above the soleal line? This is the obliques muscle, obliques. Now there's a muscle which begins from tibia. We divide the tibia into two halves. We divide the fibula into two halves. There's a muscle which arises from the tibia, fibula and interosseous membrane. Interosseous membrane. Who's this? Tibialis posterior. Tibialis posterior. Just one moment. Don't draw anything. Have a look here. Have a look. Look. Don't draw anything. See this. Now, tell me one thing. We divide the tibia into two halves. We divide the fibula into two halves. There's a muscle which begins from the tibia, fibula and interosseous membrane. That's tibialis posterior. Two muscles are left for us. One is flexor hallucis longus. One is flexor digitorum longus. Two muscles are left. Flexor hallucis longus and flexor digitorum longus. Tell me now. Flexor hallucis longus goes where? Great toe. So flexor hallucis longus should begin from which bone? It is going to the great toe, which is the bone on the medial side, tibia. So flexor hallucis longus would begin from tibia. Fine. And flexor digitorum longus has to go where? To the digits. So which bone should it ideally begin from? Fibula. It's easy. Flexor hallucis longus starts from the tibia and goes to the great toe. Flexor digitorum longus starts from the fibula and goes to the digits. But it is not like this. Ideally it should have been like this. Ideally. But everything is not ideal. It is said muscles in the posterior compartment of the leg, they arise from wrong bones. They originate from wrong bones. That means, look, understand the concept. Flexor hallucis longus would begin from where? Fibula. And flexor digitorum longus would begin from where? Tibia. Understand this. Flexor hallucis longus begins from fibula and flexor digitorum longus begins from tibia. And look. When both these muscles, they come in the sole, they're going to cross each other. So two muscles are going to cross in the sole. Who are these two muscles? Flexor hallucis longus and flexor digitorum longus. And why are they going to cross? Because they arise from wrong bones. Following this, flexor hallucis longus starts from the fibula and then goes towards the great toe. Flexor digitorum longus starts from the tibia and goes to the digits. So two muscles are going to cross in the second layer of the sole. And the moment you see two muscles are crossing, that's how you identify that as the second layer of the sole. Am I clear? Okay, that's it. Draw the slide and finish this. Now you'll understand artery. I have to tell you, I have not told you that nerve and artery. The nerve is tibial, the artery is posterior tibial artery. Now how it comes there, how it comes and how it supplies, that I'll tell you after some time. Okay, this is clear to all of you. This is the popliteus muscle. This is the insertion of popliteus. Popliteus begins from the femur and gets inserted on the tibia here, above the soleal line. That's popliteus. Okay, that's it. So that's about the muscles in the posterior compartment of the leg. TP tibialis posterior. Sole, I have to tell you, I'm just beginning with this so that gradually you'll understand it. Clear to all of you? So this is about the posterior compartment of the leg. Posterior compartment of the leg. Okay. Look at this slide and tell me now. Have a look at this. This is a very important slide. Right. So that's it. Now you tell me, which aspect of the ankle is this? This is the medial aspect of the ankle joint. And this is the posterior compartment muscles. These are the muscles of posterior compartment. Clear now? Muscles, this would be the muscles of posterior compartment, right? Now you tell me, what is this? This is the superficial muscles, gastrocnemius, soleus and plantaris. This is tendo achilles. So superficial is over. What is this now? So these are the deep muscles. Out of the deep muscles, popliteus is inserted up. Popliteus was inserted above the soleal line. So popliteus is gone. Now what are we left with? We are left with three muscles. Tibialis posterior, flexor hallucis longus, flexor digitorum longus. The nerve of this compartment, who's that? Tibial nerve. And the artery of this compartment, the posterior tibial artery. These are the structures. Fine. That's the medial malleolus. That's the calcaneum. And this is the flexor retinaculum. Like you remember, there was a flexor retinaculum here. You remember there was a tunnel here beneath the flexor retinaculum. What was that known as? carpal tunnel. So this is the flexor retinaculum, and this is what we call as the tarsal tunnel. Tarsal tunnel. So what are the structures which are passing below the flexor retinaculum, passing through the tarsal tunnel? Fine? Understand. Suppose if this comes as a visual slide for you, this comes as a visual slide, and suppose this is pointed, this tendon is pointed, look, this one, without even thinking anything, without thinking, you just have to know that this is tibialis posterior. This is tibialis posterior, because the tendon which winds around, which hooks around the medial malleus is tibialis posterior. This has to be tibialis posterior. Now, the slide which we had drawn, you remember the slide which you have just drawn, which was the muscle arising from the medial half of tibia. Muscle arising from the medial half of tibia, that was flexor digitorum longus. So this is flexor digitorum longus. Then comes an artery. What is this artery? This is the posterior tibial artery. Then comes a nerve, that's the tibial nerve. And the last one is the one which arises from the fibula, flexor hallucis longus. Don't mark this up, you've drawn that slide, you just remember the slide that we have drawn. It will be very easy for you to identify and remember. So the structure which immediately winds around the medial malleus, tibialis posterior. Then is the flexor digitorum longus, then is the posterior tibial artery, the tibial nerve, and the flexor hallucis longus. Am I clear? So this is it. This is a slide. Okay, so we start with this. Right now, structures passing behind flexor retinaculum through tarsal tunnel. Through the tarsal tunnel. Structures passing behind the flexor retinaculum through the tarsal tunnel. Okay. Sequence would be anterior to posterior. Sequence would be anterior to posterior. 1. Tibialis posterior. Second, flexor digitorum longus. Posterior tibial artery, tibial nerve, flexor hallucis longus. Yes, tibialis posterior arises from the tibia, fibula, and intraosseous membrane. Yes, and intraosseous membrane. Clear to all of you? Okay, that's it. Now we start with the next compartment, that's the anterior compartment of the leg, anterior compartment. So clear with the posterior compartment, clear with the muscles. How the nerve and vessel comes, I'll tell you after some time. Let me finish the muscles first. Nerve is tibial nerve, arteries posterior tibial artery. That much you remember for now, it's enough for me. I'll explain this after some time. Coming to the anterior compartment of the leg. Shall we start? Look here. Anterior compartment is also known as what? Anterior compartment, they do this. Look, it is also known as the extensor compartment. They do this. What is this? This is dorsiflexion. This was plantar flexion. Plantar flexion is known as flexion. Dorsiflexion is also known as extension. So all these muscles in the anterior compartment of the leg, they are going to do this. That's dorsiflexion or extension. Now, one will cause extension of great toe. What do you call this as? Extensor hallucis longus. One will cause extension of the digits. Name extensor digitorum longus. Fine. One will arise from the anterior aspect of tibia. The one which was arising from the posterior aspect of tibia was what? Tibialis posterior. So this arises from the anterior aspect of tibia. Name tibialis anterior. So which are the muscles in the anterior compartment? 1. Tibialis anterior, extensor hallucis longus, extensor digitorum longus, and there's one more muscle, peroneus tertius. Peroneus tertius. What is that? I'll tell you. Peroneus tertius. Now, so this is anterior compartment. Okay, 4 muscles. Tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Now, which is the compartment left? Lateral compartment. which is the bone on the lateral side. Fibula, fibula. Fibula looks like a pin. Fibula is therefore known as what? Peroneal. Peroneal. Muscles arising from the fibula are therefore known as the peroneal muscles. That's how you remember. One is a long muscle, one is a short muscle. Peroneus longus, peroneus brevis. And this one more muscle which arises from the fibula, but it is migrated to the anterior compartment. It's gone to the anterior compartment. And such muscles are known as tertiary muscles. And this is what we call as the peroneus tertius. Begins from the fibula but present in anterior compartment. Clear now? So that's how the peroneus tertius goes to the anterior compartment of the leg. So that's about the anterior compartment. Just have a look at this slide. That's the slide. Just one moment. Let's see. This is the slide. If this comes as a visual, then the visual slides that you get here of the lower limb. Tarsal tunnel is compression of tibial nerve. Here, have a look at the slide. What is this tendon of? This tendon. Easy it is. This is the tendon which goes to the great toe. Look now, it is going to the great toe. So what is this? Oh, one moment. This is getting out of focus. What is this tendon? Identify this. This is the tendon of extensor hallucis longus. What is this which is cut here, which would be going to the digits? This is the extensor digitorum longus. And what is this muscle here? This muscle, this is the tibialis anterior. Tibialis anterior. Just have a look here. Okay, look. So in the anterior compartment, how do you remember this? In the anterior compartment, the medialmost muscle is what? The most medial muscle, tibialis anterior. This is extensor hallucis longus. This muscle which is cut here, this is extensor digitorum longus. Extensor digitorum longus. And there will be one more. Who's that? Peroneus tertius. Peroneus tertius. I'll show you the slide. Look at this slide. Look at this slide. This is, you're looking from the lateral side. One moment. Okay, one. So what is that? You're looking from the lateral side. So what is this muscle? The first one, tibialis anterior. This one is the extensor hallucis longus. What is this? Extensor digitorum longus. And look at this. What is this now? This is the peroneus tertius. Peroneus tertius. Is this clear to all of you? Yes? I can't magnify. This goes out of focus. So tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. And this is the lateral compartment here. So what are the actions of the, what are the muscles here? One is peroneus longus and one is peroneus brevis. Okay, so this is the peroneus longus and brevis. Fine, clear to all of you? So let's start now. You know this tibialis anterior, no? This tibialis anterior is going on the medial side. Look, it is going on the medial side and it is getting inserted on the base of the first metatarsal bone. Tibialis anterior gets inserted on the base of the first metatarsal on the medial aspect. Now when this muscle contracts, what does it do? It takes the foot up like this inwards. It turns the foot inwards. So what's that? Inversion. Tibialis anterior. Image will be clear. Just one moment. Image will be clear. Tibialis anterior, in addition to dorsiflexion, what does it do? It also does inversion at the foot, inversion of the foot. Plus, you know, the foot is in the form of an arch like this. The foot is in the form of an arch. Why? Because there are nerves and vessels here below. If the foot becomes flat, the nerves and the vessels will get compressed. So there must be some factors which are maintaining this arches, otherwise the arches will become flat. So there are muscles which are coming from up, which are inserted into these bones, and they're going to pull the arches up like this. And this support is known as what? Sling. So this tibialis anterior is inserted on this medial. This is the medial longitudinal arch. Arches I'll be telling you later. So tibialis anterior is inserted on the bones of the medial longitudinal arch, and when it contracts, pulls the arch up. And this support is known as what? A sling. S-L-I-N-G, sling. So tibialis anterior acts as a sling for the medial longitudinal arch, and the muscles on the lateral side, when they contract, they're going to pull this arch up, the lateral longitudinal arch up. So they're acting as a sling for lateral longitudinal arch. Who's that? Peroneus longus and brevis. Okay, you'll understand it. Fine. Good start now. Starting with this. Yes. Okay. So now starting with the anterior compartment. Anterior compartment, muscles 1, tibialis anterior, tibialis anterior. No, extensor hallucis longus, they arise from tibia only. Tibia, they arise from tibia. Only that posterior compartment is different. Extensor hallucis longus, extensor digitorum longus. I'll quickly repeat this one later. You'll understand everything. Huh? I'll just first try to understand. Later, I'll quickly give a review of this. Nerve supply. Deep peroneal nerve and anterior tibial artery. Now, how those nerves come here, I have to tell you. I'll tell you that later. Actions, dorsiflexion at the ankle joint. Dorsiflexion at the ankle joint. Tibialis anterior also causes inversion and acts as sling for medial longitudinal arch. What is a sling? I'll tell you later. What is a sling? What is arches? That we'll be discussing later. Just remember, tibialis anterior, when it contracts, it pulls the medial longitudinal arch up. So it acts as a sling for the medial longitudinal arch. Lateral compartment. Peroneus longus. Peroneus brevis. Nerve supply. Superficial peroneal nerve. Sling is a muscle which pulls the arch up. Artery, peroneal artery. I'll show you all the slides. Just wait. Peroneal artery branch of posterior tibial artery. Posterior tibial artery. Action. Eversion of the foot. Acts as a sling form. Acts as a sling for the lateral longitudinal arch. Tibialis anterior is inserted on the medial side. That's how it causes inversion. Tibialis anterior is a muscle of anterior compartment, but if you see the insertion now, it is inserted on the medial aspect of the first metatarsal bone. Medial aspect of the first metatarsal. So when it contracts, it does what? Inversion. Plus tibialis anterior, when it contracts, it pulls this arch up, the medial longitudinal arch up, and this is what we call as a sling. Okay, and on the lateral side is peroneus longus and brevis. Clear to all of you? You'll understand. Just wait. Have some patience. You'll understand everything. At least I just want you to be familiar with the muscles first. At least you should know which muscles are in which compartment. The nerve supply, the blood supply, and then the actions. I'll quickly go through this once again. So that's about the muscles. Have a look at the slide here. Okay, now we start with this. Clear now? One moment, let the image become clear. Okay, here it is. Now just concentrate. Do not write anything. You'll understand each and everything now. Just concentrate, okay? Don't write anything, please. Okay, I start. Here we are in the popliteal fossa. That's the popliteal fossa. And look who's come in the popliteal fossa. The sciatic nerve. The sciatic nerve is the nerve of the posterior compartment of the thigh. The sciatic nerve comes from the pelvis. It comes from the pelvis. Below which muscle? If you can quickly tell me. Sciatic nerve. It's a branch of. Chalo, bolo. Now, I've not told you this, but now if you can just put this things together and if you can answer. Sciatic nerve is a branch of sacral plexus. What is the root value of sciatic nerve? L4, L5, S1, 2, 3. L4, L5, S1, 2, 3. The sciatic nerve is in the pelvis. The sciatic nerve gets outside the pelvis into the gluteal region. Now how it comes out, I'll tell you afterwards when I'm telling you the pelvis. Which is the key muscle of the gluteal region, the pear-shaped muscle, remember, piriformis. The nerve comes below the piriformis. The sciatic nerve comes below the piriformis. The sciatic nerve now lies on the pelvifemoral muscles, you remember. It comes below the piriformis. It now lies on 1. The superior gemellus, the obturator ingenuus, the inferior gemellus, the quadratus femoris. Where are we? Where are we now? From the gluteal region we come down, we are in the thigh. In the posterior compartment of the thigh, the sciatic nerve lies on which muscle? Adductor magnus. Understanding the course of sciatic nerve now? Lies on the adductor magnus, now comes in the popliteal fossa. In the popliteal fossa, the sciatic nerve now divides into a tibial and a common peroneal nerve. It divides into a tibial and common peroneal nerve. Now understand this. The tibial nerve from the popliteal fossa, the tibial nerve goes straight down. Where are we? Where are we? We are in the posterior compartment of the leg. So which is the nerve in the posterior compartment of the leg? Tibial nerve. Now clear? So all the muscles in the posterior compartment of the leg are therefore supplied by tibial nerve. They should be perfect. So that's the tibial nerve in the posterior compartment of the leg. Now, what is this nerve? That's the common peroneal nerve, and this common peroneal nerve winds around the neck of the fibula. It winds around the neck of the fibula and now divides into, here we are, a superficial peroneal and a deep peroneal nerve. The superficial peroneal nerve goes in this compartment, which is this compartment, the lateral compartment, and the deep peroneal nerve comes to, which is this anterior compartment. Is this clear to all of you? So which is the nerve of the anterior compartment? Deep peroneal nerve. Which is the nerve of the lateral compartment? Superficial peroneal nerve. And which is the nerve of the posterior compartment? Tibial nerve. You should be perfect with this, because you get MCQs. A person meets with an injury, or the person is hit by a lathi on the lateral aspect of the fibula, on the fibula. So what will the person presents with? That means which nerve is involved? The common peroneal nerve is involved. That means the superficial and the deep peroneal nerves are involved. That means That means the anterior compartment muscles are involved. The anterior compartment muscles do what? Dorsiflexion. Dorsiflexion is lost, the foot goes down, and that's how the person gets a foot drop. Understanding? This I'll tell you, just wait. And the superficial peroneal nerve supplies which compartment? Lateral compartment. So the muscles in the lateral compartment are paralyzed. You understanding? So that's how you should be perfect with all this. On legs, plenty of MCQs come. Okay, that's good. Now that's it. That's about the nerves. Understand the artery here now. Now, what is this artery? This is the popliteal artery, and the popliteal artery is a continuation of femoral artery after it pierces the adductor magnus. Okay, what was that opening known as? Hiatus magnus. Okay, the popliteal artery now divides into, here we are, a posterior tibial and an anterior tibial artery. The posterior tibial artery comes straight down, straight down, straight down. Where are we? Where are we? In the posterior compartment of the leg. So which is the artery in the posterior compartment of the leg? Posterior tibial artery. That's the posterior tibial. What does the anterior tibial do? Look, the anterior tibial is piercing the interosseous membrane, and the anterior tibial now comes to the anterior compartment of the leg. So which is the artery in the anterior compartment? Anterior tibial artery. And which is the artery in the posterior compartment? The posterior tibial artery. Am I clear? Now, there's no separate special artery for the lateral compartment, because popliteal artery gives only anterior and posterior tibial as the terminal branches. There's no artery for the lateral compartment. So someone has to give this artery to the lateral compartment. Who gives this? The posterior tibial artery here gives an artery, and this artery goes to the lateral compartment. Now, which is the bone on the lateral side? Fibula. Fibula looks like a pin. Peroneal. The artery is related to the peroneal, to the fibula. The artery is therefore known as the peroneal artery. So peroneal artery is a branch of the posterior tibial artery. This should be very clear. Okay, that's good. You're clear with all this? Clear with the nerves, muscles, vessels, everything? Okay, now with this concept, I'll just quickly go through this compartments. Yes, I'll quickly go through the compartments. Now just concentrate, do not write anything. You get a complete review of this. Okay, I start. Now I start with the leg. Have a look, listen to this. The leg is divided into a posterior compartment, anterior, and a lateral compartment. The posterior compartment muscles are divided into a superficial and deep set. The superficial muscles, gastrocnemius, soleus, plantaris, the common tendon, tendon Achilles, inserted on the calcaneum. Action, plantar flexion at the ankle joint. The deep muscle, 1, popliteus. Action, unlocking of the knee joint. Next, tibialis posterior, flexor hallucis longus, flexor digitorum longus. Actions of all these deep muscles, plantar flexion and inversion. Nerve of this compartment, tibial nerve, the artery, posterior tibial artery. That's it. Anterior compartment, muscles, 1, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. Nerve this compartment, deep peroneal nerve, artery, anterior tibial artery. And how does this artery come to the anterior compartment? After piercing the interosseous membrane. Actions of all these muscles, what do? Dorsiflexion at the ankle joint. Tibialis anterior in addition does inversion and acts as a sling for the medial longitudinal arch. That's it. Lateral compartment muscles, 1, peroneus longus, peroneus brevis. Actions, this is eversion, and it also acts as a sling for the lateral longitudinal arch. The nerve, this compartment, the superficial peroneal nerve, and the artery is the peroneal artery, which is a branch of posterior tibial artery. That's it. That's it. It's very easy. You just need 2 minutes to quickly revise all these topics. Okay, you have to be perfect with this. Okay, so the muscles of the anterior compartment, they do dorsiflexion, and which is the nerve supplying this muscles, the deep peroneal nerve. And if this deep peroneal nerve is injured, all these muscles are paralyzed, the foot goes down. That's a foot drop. So foot drop occurs due to injury too. Your first answer is always common peroneal nerve, because that's a nerve very commonly injured. If common peroneal is not in the options, only then you answer this as deep peroneal nerve. Yes, that's it. Okay. There we are now. Okay. Start with this foot drop. Occurs due to injury to. It's good, you understand it well, very nice. Foot drop occurs due to injury to. Foot drop occurs due to injury to common peroneal / deep peroneal. Okay. Deep peroneal, right? And how does a person walk? This foot is normal and this foot rubs against the ground. It rubs against the ground. What does the person do now? The person lifts this foot to a very high level and he puts it down. This foot is normal. The person lifts his foot to a very high level and he puts it down. And this is what we call as a high stepping gait or a stamping gait, or you seen soldiers? Marching gait. Marching gait. So what is the gait that we get here? A high stepping . No, anterior compartment does no superficial and deep muscles. Posterior there is. Marching gait. Yes. Okay, that's it. Clear to all of you? Now, insertion of some muscles are very important for us. So once you understand the insertion of this muscle, then you'll understand the layers of the sole. Layers. So insertion of this muscle is very important. Understand some muscle whose insertions are very important for us. Okay. Two, three muscles which insertions you have to know. Starting with this. Okay, I'll start. Have a look. So once this insertion is clear now, you'll understand the layers of sole. Another very important thing is layers of the sole, the muscles, the slides you get as visuals in the layers of the sole. And then the last part will be left. Okay, we'll finish, we'll start. Here we are. Now you tell me, muscle which winds around the medial malleolus. What is this? The tendon which winds around the medial malleolus is tibialis posterior. Tibialis posterior. Yo, before we start with this, just identify the bones. Look, this is the dorsal aspect of the foot. What are the bones here? This is the calcaneum, that's the talus, that's the navicular, this is the cuboid, these are the cuneiforms, and these are the metatarsal bones. Clear? So from the dorsal aspect, this is calcaneum, talus, navicular, cuboid, cuneiforms, and these are the metatarsals. From the plantar aspect, we are going to study the plantar aspect. This is calcaneum, that's talus above, this is cuboid, this is navicular, these are the cuneiform bones, and these are the metatarsal bones. Metatarsal. Okay, I'm starting here. Do not write anything. I'll be writing this for you. Just concentrate. Just concentrate. I'll start. The tendon, the muscle, the tendon which winds around the medial malleolus is what? The tibialis posterior. Tibialis posterior winds around the medial malleolus and comes and gets inserted on this bone. What is this bone? This is the navicular bone. Navicular. If you see the plantar aspect of the navicular, we get an elevation. Look at this elevation here, and this is known as the navicular tuberosity. Navicular tuberosity. So the main insertion on navicular tuberosity is tibialis posterior. Tibialis posterior. That's the main insertion. After getting inserted on this navicular bone, this tibialis posterior will send small insertion to all the tarsals and metatarsal bones. That means tibialis posterior is inserted in all the tarsals and metatarsal bones except MCQ is the only tarsal bone which does not receive any muscle attachment is The only tarsal bone which does not receive any muscle attachment is talus. Remember, talus is a bone where no muscle is attached. That means tibialis posterior is not inserted on the talus. It is also not inserted on the first and the fifth metatarsal bones. Three bones it is not inserted. Talus, the first and the fifth metatarsal. Otherwise, tibialis posterior is inserted in all the tarsals and metatarsal bones. And when a muscle has to get inserted into all the tarsal and the metatarsal, it has to go in the last layer of the sole, a layer which is very, very close to the bone, so that it gets inserted into all the bones. And which layer is that? That's layer number 4. Layer number 4, that's the last layer of the sole. So now we'll be studying the layers of the sole, and which muscle are we going to get in layer number 4? Tibialis posterior, because it has to get inserted in all the tarsal bones. Okay, that's how you remember this, tibialis posterior. A very, very important muscle, tibialis posterior. Fine, starting with this tibialis posterior. Just be faster. Tibialis posterior. All these points which I am writing are very important. Understand them. 1. Winds around the medial malleus. Winds around medial malleus. Second, winds around the medial malleus, chiefly inserted on navicular tuberosity. Chiefly inserted on the navicular tuberosity. Sense slips. Slips are small insertions. Sense slips to all the tarsals and metatarsals except talus, first and fifth metatarsal. Except talus, the first and the fifth metatarsal. Slips are small insertions, remember. Sense slips to all the tarsals and metatarsals except the talus, the first and the fifth metatarsal. It is not inserted. Another very, very important muscle is peroneus longus. Okay, fine. Clear with this? Tibialis posterior is clear. Now understand this peroneus longus are very important. Just concentrate. No? Fine. If this comes as a visual slide for you, and if this is pointed to you, this is a muscle which winds around the lateral malleus. Now we know this is the lateral compartment of the leg. And we also know that there are two muscles in this lateral compartment. One is the peroneus longus, peroneus brevis. Only two muscles. Out of these two, the muscle which winds around the lateral malleus is peroneus brevis. Remember, it's peroneus brevis. And how do we know this is peroneus brevis? Because peroneus brevis is inserted on the fifth metatarsal bone. That's the insertion of peroneus brevis. So this is peroneus brevis. Fine. So what is this muscle now? Peroneus longus. This has to be peroneus longus. Okay. Peroneus longus, a very important MCQ, have a look. Peroneus longus goes behind the brevis. It goes behind the brevis, reaches this bone, which is the bone here, cuboid. Okay, so peroneus longus goes behind the brevis. It goes till the cuboid bone. Here we are now. Peroneus longus goes behind the brevis. It comes here. It comes till the cuboid. Now it turns at right angles. Like this. And when it turns at right angles, it forms a groove below the cuboid. Look at this. You can see a groove here. The groove below the cuboid is for what? Peroneus longus. A very important visual, right? So this is the groove below the cuboid, and that's for peroneus longus. So peroneus longus goes behind the brevis like this comes till the cuboid, turns at right angles, passes below the basis of metatarsal bones, passes below the basis of metatarsal bones and is inserted here. Tell me, what is this? This is the first metatarsal and this is the medial cuneiform. Which aspect is it? Lateral aspect. That's the lateral aspect. It has to be lateral aspect. It cannot come on this and get inserted here, right? So because this muscle is coming from the lateral side, so it will come and get inserted on the lateral aspect of the base of the first metatarsal and medial cuneiform. Look at this one again. Peroneus longus goes behind the brevis till the cuboid, turns at right angles, grooves the cuboid, passes below the basis of metatarsal bones and gets inserted on the lateral aspect of the base of the first metatarsal and medial cuneiform. Now this muscle has got a very long course, and I told you, when a muscle has got a very long course, it gets inserted into many tarsal bones, and when a muscle gets inserted into many tarsal bones, it goes in which layer of the sole? The last layer of the sole. That's layer number 4. So layer number 4 will be finding two muscles, one tibialis posterior, second the peroneus longus. That's it. That's how you remember the layers of the sole. Okay. So that's about the peroneus longus. Clear now to all of you? Starting with peroneus longus. But two muscles are very important. You need to know this. Peroneus longus. Start. It goes behind the brevis. Goes behind the brevis till cuboid. Goes behind the brevis till the cuboid. Turns at right angles. Turns at right angles. Grooves the cuboid. Turns at right angles, grooves the cuboid. Passes below the basis of metatarsal bones. Passes below the basis of metatarsal bones. Inserted lateral aspect of the base of the first metatarsal and medial cuneiform. That's it. Inserted on the lateral aspect of the base of the first metatarsal and medial cuneiform. I showed you now on the slide. Peroneus longus, now it's on the lateral side, no? So it's on the lateral side and it has to go on the first metatarsal. So it goes from the lateral side, it goes on the medial side. So it has got a very long course. It goes behind the brevis, reaches the cuboid. Now then it turns like this at right angles, like this. Turns at right angles, passes below the basis of the metatarsal bones and gets inserted on the medial lateral aspect of the base of the first metatarsal and medial cuneiform. Okay, clear to all of you? So that's about the peroneus longus. Fine, but this concept, now understand the layers of the sole. Okay, all these things I told you to understand the layers of the sole. Goes behind the brevis. The first point was it goes behind the brevis till the cuboid. Goes behind the brevis till the cuboid. Goes behind the brevis till the cuboid. behind the brevis, below the brevis, same. Okay, clear to all of you? Chalo, fine. Now starting with layers of the soul. This we are now finishing this, be fast. Layers of the soul. Now just understand this, layers of the soul. Difficult to understand from the books. I'll make it very easy for you. Understand. Layers of the soul. Now this is the great toe. Don't write anything, just have a look. This is the great toe, that's the little finger. Great toe, little finger. Brevis is inserted on the 5th metatarsal bone. Base of the 5th metatarsal. Peroneus brevis is inserted on the base of the 5th metatarsal bone. Clear now? Peroneus brevis is inserted on the base of the 5th metatarsal bone. Base of the 5th metatarsal. Okay, layers of the soul. Now just listen here. Don't see. Peroneus longus doesn't wind around the lateral malleus. Listen here, no confusion. Peroneus brevis winds around the lateral malleus and is inserted into the base of the 5th metatarsal bone. No confusion, huh? Peroneus brevis winds around the lateral malleus and is inserted on the base of the 5th metatarsal bone. It's not longus. Longus will go behind the brevis. Yes, is this clear to all of you? Okay, now starting with layers of the soul. Great toe, little finger. Now, there are 4 muscular layers in the soul. 4 muscular layers. This is great toe. This is great toe. This is little finger. There are 4 layers of muscles. Don't write this. Don't write this. Just wait. Don't write this. So this is the great toe. This is the little finger. Now, there are 4 layers, out of which the first and the third layer are said to be intrinsic. Listen here now, do not write anything, just concentrate. The first and the third layer are intrinsic. Intrinsic meaning small muscles, and all the small muscles will end with what? Small. Brevis. All the small muscles will end with brevis. Like you remember the muscles of the hand, the small muscles, they were ending with brevis. So the first and the third layer are intrinsic, and intrinsic muscles will end with brevis. Okay, look, this is so easy. Put an abductor here, and put a flexor here. Name. Abductor hallucis brevis. Don't write, listen. Abductor digiti minimi brevis. And between 2 abductors, put a flexor. This is known as the flexor digitorum brevis. I'll write this and don't write. So abductor, between you put a flexor. That's the first layer. Now, in the third layer, take flexors on both the sides. Put a flexor here, and put an adductor here. Name. Flexor hallucis brevis, flexor digiti minimi brevis. And you remember, who was this? Adductor pollicis. So who will this be? Adductor hallucis. That's how you remember it. It's very easy. Clear? So in the first layer, abductor, between is a flexor. In the third layer, flexors, in between put an adductor. So this is first and the third layer. These are small intrinsic muscles. Okay. Now come to the second and the fourth layer. The muscles will come from the leg. They are said to be extrinsic. Partly extrinsic, partly intrinsic there. So muscles will come from the leg. You remember the muscles which were arising from round bones. Who was that? Yes, flexor hallucis longus, flexor digitorum longus. Yes, this arises from round bones. And I told you, this flexor digitorum longus is similar to which muscle of the upper limb? Flexor digitorum profundus. And you remember the small worm-like muscles which were arising from the profundus? Lumbricals. So what arises from this tendon are the lumbricals. So what arises from the tendons of flexor digitorum longus would be the lumbricals. And this one more. You tell me, flexor hallucis longus begins from which bone? I told you this. Flexor hallucis longus begins from where? Tibula. What's tibula? Flexor hallucis longus begins from where? Tibula. There's nothing like tibula. It's like tomato and potato. Flexor hallucis longus begins from Fibula. Yes, fibula. Which half? The lateral half of fibula. And flexor digitorum longus begins from where? It begins from the tibia, the medial half of tibia. And when both these muscles come in the sole, they're going to cross each other. They cross each other. Now, flexor hallucis longus starts from the fibula, comes in the sole and goes towards the great toe. It's a single tendon. Single tendon starts from the fibula, comes in the sole and goes towards the great toe. It goes on its own, single muscle. Whereas flexor digitorum longus starts from the tibia, comes in the sole. It has four tendons. It has to go laterally. Cannot go. It's a big muscle. It cannot go on its own. Help. It needs help. So there's a special muscle here. In the second layer, there's a special muscle. Begins from the calcaneum, attached to this muscle. It is attached to this muscle. What is the function of this muscle? It is going to pull. It pulls this muscle laterally so that this muscle goes towards its insertion. And this is an extra muscle. An extra muscle to this flexor digitorum longus. Anything extra is known as accessory. And this is what we call as the flexor digitorum accessorius. Okay, flexor digitorum accessorius. Where does it begin from? Calcaneum. And where is it attached to? It's attached to this muscle itself, and it pulls this muscle laterally so that this goes towards its insertion, and this is the flexor digitorum accessorius. Okay, so the next muscle is flexor digitorum accessorius. I'll show you the slides, it will be very clear. Okay, that's it. So muscles in second layer, flexor hallucis longus, flexor digitorum longus, lumbricals, and flexor digitorum accessorius. And the last layer, we know this is tibialis posterior. You remember muscles which are inserted in all the tarsal bones. Tibialis posterior, peroneus longus. And muscles between the bones are known as what? Introsci. Introsci. You remember how many introsci there in the hand? 8. In the foot there are 7 introsci, 4 dorsal and 3 plantar. 4 dorsal, 3 plantar. That's how it is. Okay, so that's the layers of the sole. Is this clear to all of you? Now do one thing. Starting with layers of the sole. This is the easiest way, and this is what I have made. This is my way of remembering the layers of the sole. Okay, starting with layers of the sole. Write down. I'll write down the names here. Start. Layers of the sole. Great toe, little finger. Great toe, little finger. Start. Abductor hallucis brevis. Abductor hallucis brevis. Abductor digiti minimi brevis. Abductor digiti minimi brevis. And in between is flexor digitorum brevis. Flexor digitorum brevis. Little finger and little toenail. Okay, starting with the third layer, I'll write this, just write down the flexor hallucis brevis. Flexor digiti minimi brevis. Adductor hallucis. Adductor hallucis. Okay. Second layer you write flexor hallucis longus, flexor digitorum longus, lumbricals, and this is the flexor digitorum. Flexor digitorum accessorius. This is also known as quadratus plantae. This muscle is very well developed in animals walking on 4 legs, quadrupeds. It is therefore known as quadratus plantae. Quadratus plantae. So flexor hallucis longus, flexor digitorum longus, lumbricals, and flexor digitorum accessorius. The last layer, tibialis posterior, peroneus longus, introsal, 7 introsal, 4 dorsal, 3 plantar. Okay, is this clear to all of you? So this is how you remove the layers of the sole. Now understand the nerve supply of these muscles. What MCQs we get on the nerve supply? Done? Okay. Now see how to remove the nerve supply. I'll make it very easy for you. Now this first layer is purely intrinsic. They have not been supplied by anything, any nerve. This third layer is purely intrinsic. They have not been supplied by anything. The second layer, flexor hallucis longus and flexor digitorum longus. Tell me, this comes from where? They come from the posterior compartment of the leg. Nerve. Which is the nerve? Tibial nerve. They have already been supplied. These two muscles have already been supplied. These two are left. Layer number 4, tibialis posterior, is a muscle of which compartment? Posterior compartment. Supplied by whom? Tibial nerve. So this is already supplied. Peroneus longus is a muscle of which compartment? Lateral compartment. Supplied by whom? Superficial peroneal nerve. So this we remove now. Now that what you are looking are purely intrinsic muscles. Now this, second layer mein, this is intrinsic, and fourth layer mein, this is intrinsic. The rest of this two are extrinsic and these are extrinsic muscles. Now understand the nerve supply of these muscles. I'll write in a different way. You followed now? These two muscles have already been supplied in the leg. This is supplied in the leg. This is supplied in the leg. So now understand the nerve supply of the sole of the foot. Don't write anything. Look, understand this first. It is slightly difficult here. Understand this. I'll make it easy. This is great too. That's the little finger. These are the layers here. I'll write in a different way. Look. Flexor hallucis. This is abductor hallucis brevis. Abductor hallucis brevis. Abductor digiti minimi brevis. And this is flexor digitorum brevis. In the third layer, this is flexor hallucis brevis, flexor digiti minimi brevis, and this is adductor hallucis. In the second layer, now I break this lumbricals. First lumbrical, I write this separately. First, second, third, and fourth. I have written this separate. 4 dorsal, 3 plantar, yes. Second, third, and fourth. And this is the flexor digitorum accessorius. And the last layer, introsal. You're following this? What I've written now is purely intrinsic muscles. These are the muscles of the sole, muscles in the sole. So these are purely intrinsic. Now listen how to remember this. Just one moment, give me one moment. Don't draw anything. Don't draw anything, you'll not understand. Look, 2 muscles in the first layer, 1 muscle in the second layer, and 1 muscle in the third layer. This is supplied by, any guess? Medial plantar nerve. Medial plantar nerve. This also supplies 3.5 fingers. Skin of 3.5 fingers. Remembering this. And look at this. Who's this? All this would be supplied by whom? This would be the lateral plantar nerve. And this also supplies the skin over 1.5 fingers. Skin over 1.5 fingers. That's how you remember it. And this is what I was trying to tell you. The medial plantar nerve is similar to which nerve of the upper limb? 3.5 fingers. You understand? Medial nerve. So medial nerve is supplying less muscles in the hand and more of skin. Remembering 3.5 fingers. So medial nerve corresponds to which nerve of the lower limb? Medial plantar nerve. and ulnar nerve was supplying many muscles and less skin. So here that the lateral plantar nerve resembles to ulnar nerve, supplies 1.5 fingers and many muscles in the sole. Okay, that's it. Yes, that's good. Very good. So that's about the sole. Clear to all of you? And medial and lateral plantar are branches of what? They are branches of tibial nerve. Both are branches of tibial nerve. Okay, look at the slides and be clear about this. Arteries are between the first and the second layer, third and fourth. Between the first and the second, and between the third and the fourth layer. So total, if you see, no, there will be 6 layers, 4 muscular layers and 2 layers of nerves and vessels. Between the first and the second layer lies the nerves and vessels. Between the third and the fourth layer lies the nerves and vessels. It's like that. That's very easy to remember. Previous slide. Just one moment. I'll put the previous slide. One moment. Nerve supplies medial and lateral plantar nerves. Medial and lateral plantar. Nerve supply is medial and lateral plantar nerves. Okay, finish this. One moment, finish this. This is done. Okay, write it down. All introduction and lateral plantar nerve. Yes. Lunch break 2:30. I have to finish the lower limb. Purely intrinsic meaning they lie in the soul. Purely intrinsic meaning they lie in the soul. You're done with this? Quickly tell me. They lie in the soul. Okay, just wait. I'll tell that. Okay, done. Fine. Now understand this. Understand this now. See the layers, muscles in the soul. Arteries are between the first and the second and third and fourth. Just I'll tell you, just wait. Let me finish this first. Have a look. Understand this now. Look, this is the first layer of the soul. How do you remember this layers? Yep, that's the first layer of the soul. Okay, nervy hesitans is deep peroneal nerve. You're having the notes now. Just wait. Okay, yeah, I start. This is the first layer. This is one muscle. See, how do you remember this? You understand this now? This is one muscle, and that's the third muscle. So who's this? Understand how to remove this? This is abductor, and this is flexor. So what is this now? This is the abductor hallucis brevis, abductor digiti minimi brevis, and what's this? This is the flexor digitorum brevis. Okay. Now come to the third layer. This is one muscle, and that's the third muscle. So who's this? This is a flexor, and this is an adductor. So this is the flexor hallucis brevis, this is the flexor digiti minimi brevis, And who's this? Adductor hallucis. Adductor hallucis. Now come to the second layer. Second layer. Look, two muscles are crossing here. Understand, two muscles are crossing because they arise from wrong bones. So what is this here? This is the flexor hallucis longus. What is this here? Flexor digitorum longus. You can see these four tendons of flexor digitorum longus. And look at this small worm-like muscles. What are these? These are the lumbricals, small worm-like muscles. These are the lumbricals. And I told you, flexor digitorum longus is a big muscle, cannot go on its own. So there's a special muscle here. Where does this muscle come from? Calcaneum. And where is it attached to? It is attached to this muscle only. And this is the flexor digitorum accessoris. Clear? So that's the flexor digitorum accessoris. And the last layer, muscles which are inserted in all the tarsal bones here. Muscles which are inserted in all the tarsal bones. This is tibialis posterior, peroneus longus, and the muscles between the bones. What are they? Interossei. Interossei. Clear to all of you? So this is about the layers of the soul. Now understand this. Some MCQs I'll tell you about this. So we'll start. Strongest layer of the hip joint. Just write some MCQs. This is the last part. Strongest ligament of the hip joint. See, this is the ligament. This is the strongest ligament of the hip joint. What is this? Begins from the ilium attached to the femur. And this is what we call as the iliofemoral ligament. Iliofemoral. It's an inverted Y-shaped ligament. Inverted Y. Where is the stem of the Y attached to? It is attached to the anterior inferior iliac spine, and the two limbs are attached to the intertrochanteric line. This is the iliofemoral ligament, or the ligament of Bigelow. And what does this ligament prevent? If you take the thigh back, that means what? Extension. If we extend the thigh, we can't go beyond a particular limit. That means what is this ligament preventing? Hyperextension at the hip joint. It prevents hyperextension at the hip joint. Second, this ligament also prevents this. What is this? The trunk from falling backwards. It prevents the trunk from falling backwards. Okay. So strongest ligament of hip joint is iliofemoral ligament. Iliofemoral ligament, also known as the ligament of Bigelow. Inverted Y-shaped. Inverted Y-shaped. Attached to anterior inferior iliac spine, attached to the anti-iliac spine and intertrochanteric line prevents hyperextension. Prevents hyperextension at the hip joint. Prevents hyperextension at the hip joint. And second, prevents the trunk from falling backwards. Okay, it prevents the trunk from falling backwards. It prevents the hyperextension of the hip joint, and second, it prevents the trunk from falling backwards. Okay, understand this now. ACL and PCL, slightly difficult to understand. Look, I'll just demonstrate and I'll tell you. Hold. Demonstrate. Okay. Understand this now. ACL and PCL. Prevents hyperextension at the hip joint, prevents the trunk from falling backwards. Okay, clear? I'll tell that course of the nerves. Just one moment. What is this? What is this? The full screen, tell us on the full screen. Okay, understand this now. ACL and PCL. Okay, ACL and PCL. Now both this ACL and PCL are intracapsular and extrasynovial. They are within the capsule of the knee joint, but they are outside the synovial membrane. Synovial membrane. Abbas ji, full screen, the full screen. Just one moment. Both this ACL and PCL are intracapsular and extrasynovial. It's not taking the phone. One moment. I need a full screen. Full screen, full screen. Clear now with the layers of the sole, with everything? Okay. Strongest ligament of hip joint is iliofemoral ligament or the ligament of Bigelow. It's an inverted Y-shaped ligament. It is attached to the anterior iliac spine and the stem is attached to the intertrochanteric line. What does this ligament do? It prevents hyperextension at the hip joint, and second, it prevents the trunk from falling backwards. Okay. Now just understand this. This is the femur here. Okay, just understand this. These are the two condyles of femur. Do you understand? So these are the two condyles of femur. Just one moment. These are the two condyles of femur. Okay, this is fine. These are the two condyles of femur. And these are the two condyles of tibia. These are the tibial condyles. Okay, just imagine if this is my right femur. If this is the right femur, like this. This is the right femur. That's the head, that's the neck, that's the shaft of the femur. We can understand this. These are the two condyles. This is the femur like this. That's the head of the femur. That's the neck, that's the shaft, and these are the two condyles of the femur. Two condyles. Oh, it was not seen properly. Okay, this is fine. These are the two condyles now. Just try to understand this. These are the condyles of the femur, right? That's the right femur. This is the head, this is the neck, this is the shaft, and these are the two condyles of the femur. If that's my right femur, what is this condyle? That's the medial condyle. What is this condyle? Lateral condyle. The medial condyle has got the medial surface and a medial surface and a lateral surface. The lateral condyle has a medial surface and a lateral surface. You're following? So that's the right femur. This is the medial condyle. That's the lateral condyle. Medial surface, lateral surface, medial surface, lateral surface. These are the two condyles of what? Tibia. These are the two condyles of tibia. Now ACL begins from the anterior aspect of tibia, from front, comes and gets inserted backside on the posterior aspect of the medial surface of lateral condyle. You following this? Following? Look, this is the lateral condyle. Which surface is this? Medial surface. So ACL begins from the tibia, comes and gets inserted on the posterior aspect of the medial surface of lateral condyle. PCL begins from behind, goes in front, gets inserted on the anterior aspect of the lateral surface of medial condyle. Are you able to follow this? Yes, are you able to follow this? Okay, fine. Understanding clear to all of you. Thank you. Fine. So this is ACL and PCL. Understand this now. Starting with ACL. Okay. Okay, write down ACL. A very important MCQ. ACL. Intracapsular and extrasynovial. Intracapsular and extrasynovial. Fine. Intracapsular and extrasynovial. Attached to posterior surface of posterior aspect of attached to the posterior aspect of he is not my brother, he is my son. Attached to the posterior aspect of lateral of medial attached to the posterior aspect of medial surface of lateral condyle. Okay, just be fast now. Clear now? So ACL attached to the posterior aspect of the medial surface of lateral condyle. Now, what does this ligament prevent? This ACL prevents this. What's this? The anterior displacement of tibia on femur, and the ACL becomes taut during extension. Okay, fine. Finish this. Prevents anterior displacement of tibia. Prevents the anterior displacement of tibia on femur. Prevents the anterior displacement of tibia on femur. These are very important points. Gets taut during. Taut is tensed up. Gets taut meaning tensed. Intracapsular and extrasynovial. It is extrasynovial. Make that change now. It is extra. Both of them are intracapsular and extrasynovial. Gets taut during extension. This is clear now. It gets taut during extension, and this is what I was telling you. When it is taut, the femur takes support of ACL and turns medially, undergoes a medial rotation. That was locking of the knee joint. Clear to all of you? It arises from the anterior aspect of tibia. ACL begins from the anterior aspect of tibia and comes and gets inserted on the posterior aspect of femur. Which posterior aspect? Which condyle? Lateral condyle. Which surface? Medial surface. PCL. Intracapsular and extrasynovial. Intracapsular and extrasynovial. I'll tell you origin. Intracapsular and extrasynovial attached to anterior aspect. Attached to the anterior aspect of lateral surface of medial condyle. Anterior aspect of the lateral surface of medial condyle prevents posterior displacement of tibia on femur. Prevents the posterior displacement of tibia on femur. Gets caught during flexion. Gets caught during flexion. Yeah, so this is ACL and PCL. Yes, they are avascular and non-nervous, both ACL and PCL. They derive from diffusion. No? Get start during flexion. Clear to all of you, no? You want the attachments, no? One moment, I'll tell you that. See, it is something like this. So what I've drawn? Okay, this is the tibial tuberosity. These are the two condyles of the tibia. This is the medial condyle and that's the lateral condyle of tibia. And this is the top means tensed, yes. And this is the arrangement of structures. Now these are the two condyles of tibia, and between the two condyles there is a small elevation. This is what we call as the intercondylar eminence. Intercondylar eminence. This is the tibial tuberosity. This is anterior, this is posterior. Okay, so I'll just write it like this. Arrangement of structures. Arrangement of structures on the intercondylar eminence of tibia. You understand what is intercondylar eminence? Clear now? Yes. This is the medial condyle, lateral condyle, and in between there's an elevation, that's the intercondylar eminence. So what are the structures attached to the intercondylar eminence? I'll just put this as number 1, this is 2, this is 3, this is 4, this is 5, and this is 6. You must be knowing this. This is the medial meniscus and this is the lateral meniscus. So what is 1? 1 is the anterior horn of anterior horn of medial meniscus. Anterior horn of medial meniscus. 2 is the anterior cruciate ligament. 3 is the anterior horn of lateral meniscus. 4 is the posterior horn of lateral meniscus, posterior horn of medial meniscus, and 6 is a posterior cruciate ligament. This you must be knowing now. Medical College Lucknow and Lucknow Medical College. Medical College Lucknow, Lucknow Medical College. So you wanted the attachment of ACL and PCL on tibia, so I've told you that. Okay. So where is the ACL attached to the tibia? Where is the PCL attached to the tibia? Clear to all of you? Okay, fine. I'll finish this, then you take a break. Just 2-3 things more. Fine, clear to all of you? Okay. Some MCQs. Okay. Chalo, just 2 or 3 things more. We'll finish this, then you take a lunch break. Yep. See the slide and tell me. The bursa which communicates with popliteal fossa, I've told you the boundaries and the contents. That's it. Just see here. The bursa which communicates with the cavity of knee joint. Answer this. The bursa which communicates with the cavity of knee joint. Popliteal fossa, I've told you the boundaries, I've told you the contents there. Right now, bursa, some MCQs, bursa which communicates with intercondylar eminence. Bursa which communicates with capsule of the knee joint. Some MCQs. This one, the bursa which communicates with the cavity of the knee joint, cavity. Bursa which communicates with cavity of the knee joint. Cavity of the knee joint is suprapatellar. Bursa which communicates with the cavity of knee joint is suprapatellar bursa. I'll tell you, just let me finish this. Bursa which communicates with the cavity of knee joint is suprapatellar bursa. Next, inflammation of prepatellar bursa is known as housemaid's knee. Inflammation of the prepatellar bursa, housemaid's knee. Inflammation of infrapatellar bursa, clergyman's knee. Clergyman's knee. Inflammation of infrapatellar bursa is clergyman's knee. Clergyman is a priest who kneels down and prays. Clergyman's knee. And inflammation of the bursa over distal tuberosity is Weaver's Taylor's students. Weaver's bottom, Taylor's bottom, or student's bottom. Inflammation of the bursa over the distal tuberosity is Weaver's bottom, Taylor's bottom, or student's bottom. You're clear with all this now? Okay. Fine. Clear to all of you. This were some MCQs. Now just see this. I'll tell you arches of the foot. Arches of the foot. Some MCQs which are asked on arches of the foot. Now, foot is in the form of an arch like this. Listen now. The foot is in the form of an arch like this. Arch. There are two arches. One is the medial longitudinal arch. One is the lateral longitudinal arch. There are some points which you need to know about this medial and lateral longitudinal arches. First, what are the bones which takes part in the formation of this arch? I'll start. This is the medial longitudinal arch. This is the medial longitudinal arch. I'll later put some things for you on the club also. Okay, now tell me, what are the bones which takes part in the formation of the medial longitudinal arch? I'll start. This calcaneum, talus, navicular, 3 cuneiforms and 3 metatarsal bones. This is the one which forms the medial longitudinal arch. Medial longitudinal arch. And what is the one which forms the lateral longitudinal arch? Lateral longitudinal arch is formed by calcaneum, cuboid, the fourth and the fifth metatarsal bones. Calcaneum, cuboid, the fourth and the fifth metatarsal bones. This is going to form the lateral longitudinal arch. Just some points I'll tell you about the venous drainage. Fine. So starting with this, medial and lateral longitudinal arches. The bursa which communicates with the cavity of the knee joint, not the intercondylar eminence, the cavity of the knee joint, is suprapatellar bursa. Okay, just finish this now. I'll tell you what is left, I'll tell you, just wait. Okay, make two columns like this, medial longitudinal arch, lateral longitudinal arch, medial longitudinal arch, lateral longitudinal arch. Yes, I'll put all these things. Medial longitudinal arch, lateral longitudinal, starting with the first point, bones. Bones. Calcaneum, talus, calcaneum talus, navicular, cuneiform, metatarsal bones. Lateral longitudinal arch, calcaneum, cuboid, fourth and fifth. Let me finish this, I'll finish this, metatarsal bones. Calcaneum, cuboid, fourth and fifth metatarsal bones. 230. Okay. So calcaneum talus, navicular, 3 cuneiforms and 3 metatarsals, calcaneum cuboid, 4th and 5th metatarsal. Now tell me how this arch is maintained, like how this arch is maintained, otherwise this arches will become flat, no? So there must be something which is maintaining this arches. And what's that? Look at this one moment. One is the shape of this bones, like if one is convex, the other one is concave. They fit into each other. So one is the shape of the bones. They fit into each other. If one is concave, the other one is convex. They fit into each other. Now, second point. Look, each of this bone acts as a segment, right? Just understand. Each of this bone acts as a segment. Like, for example, this is one segment. This is the second segment. That's the third segment, fourth segment. These are different segments. And tell me now, who's going to tie all the bones together? Means who's going to bind the bones together? Means who's going to bind all the segments together? And this will be ligaments. And what is this support known as? This is what we call as the intersegmental tier. It's not T-Y-E-R, it's T-I-E-R. Tier is to tie. Intersegmental tier. So look once again, each of these bones acts as a segment. These are different segments, and who's going to hold the bones together? These are the ligaments, and this support is what we call as the intersegmental tier. Now see the slide and tell me, what is this ligament? This ligament is going to hold the bones of medial longitudinal arch together, and this is what we call as the spring ligament. So spring ligament is going to support which arch? The medial longitudinal arch. And what is the type of support? This is what we call as a sling. This is what we call as, intersegmental tier. So who's an intersegmental tier for the medial longitudinal arch? Spring ligament. And for the lateral longitudinal arch, what is this ligament which binds the bones of lateral longitudinal arch together? This is known as the short and long plantar ligaments. You're following this point? The next is intersegmental tier. Yep. After the bones, right? intersegmental tie. Intersegmental tie is the one which binds the bones. For the medial longitudinal arch, it is the spring ligament, and for this it is the short and long plantar ligaments. Short and long plantar ligaments. Okay, they bind the bones of lateral longitudinal arch. And I told you the last support, the muscles which are coming from up, they're attached to this bones and they pull this arch up. What is that known as? A sling. Or the muscles which are inserted in all the tarsal bones, when they contract, they pull this arch up. This is also known as a sling. So sling is another support, sling. So who acts as a sling for the medial longitudinal arch? It's tibialis anterior. This I told you. And which is the muscle which is inserted in all the tarsal bones? That is tibialis posterior. For the lateral longitudinal arch, it is peroneus longus and peroneus brevis. Peroneus longus and peroneus brevis. So just remember this much for the arches of the foot. This is what is asked. For the arches of the foot. Okay. Clear? Now tell me. This is the dorsum of the foot. And on the dorsum of the foot, there is an arch here. What do we call this arch as? On the dorsum of the foot, this is what we call as the dorsal venous arch. This dorsal venous arch will have two ends. This is the medial end, this is the lateral end. And there's a vein which comes from the great toe, and deltoid ligament is a different ligament. Deltoid ligament is ligament of ankle joint. Deltoid ligament is a ligament of ankle joint. It supports the ankle joint. It's a ligament of ankle joint. It is not a ligament of which is supporting the arches. Okay. So this is the dorsal venous arch. This is the medial marginal vein. Okay, I'm telling you. Medial marginal vein. That's the lateral marginal vein. Lateral marginal vein comes from the fifth metatarsal bone. This is great saphenous. Oh, I'll tell you, wait. And this is short saphenous. Okay, so this is the dorsal venous arch. This is the medial marginal vein. That's the lateral marginal vein. This is the great saphenous, and that's the short saphenous vein. Just draw this. So some MCQs which are asked, that only that I'm telling you. MCQs which are asked here. Five more minutes, I'll finish it. Draw this. Dorsal venous arch, medial marginal vein, lateral marginal vein, great saphenous, short saphenous. Great saphenous, short saphenous vein. Formed by joining of medial end of dorsal venous arch with medial marginal vein. Formed by joining of the medial end of the dorsal venous arch with the medial marginal vein. You can join this, write this, formed by the joining of lateral end of dorsal venous arch with lateral marginal vein. Goes in front of medial malleus. Great saphenous vein goes in front of medial malleus, goes behind lateral malleus. Dorsal venous arch है, dorsal venous arch. DVA is dorsal venous arch. Same, dorsal venous arch. Wait, I'll put. Goes behind the lateral malleus. Accompanies the saphenous nerve. Great saphenous vein accompanies the saphenous nerve. Short saphenous vein accompanies the sural nerve. Opens into femoral vein. Opens into femoral vein. Opens into popliteal or posterior tibial vein. Opens into the popliteal vein or posterior tibial vein. Okay, just read the notes properly. Read the notes again and again and again. Notes should be on the tip of your tongue. Okay, and then see the visual slides. The more visuals you see, the more your concepts will be clear. Fine, no? You'll understand. You'll understand everything. Fine. That's about the veins. And just one last thing I'll tell you. Adductor canal I'll tell you. Baki popliteal fossa I've told you the boundaries. I'll just tell you the adductor canal and then we'll stop. Look, just try to understand this. Adductor canal. That's the femur. Just 2 minutes. I'll finish this. Adductor canal. See, this is the femur. This is medial and this is lateral. Listen here now. Listen here. 2 minutes. Listen here. Do not write anything. Just 2 minutes. Okay. What's this muscle? What's this muscle? Vastus medialis. What's this muscle? That's the femur here. Vastus lateralis. What's this? Vastus intermedius. And what's this? Rectus femoris. This is clear? I'll tell that somewhere. I'll tell you that later. Dorsum is superficial peroneal. Dorsum of the foot is superficial peroneal. Only superficial peroneal. Okay, what is this muscle? Adductor longus. In the upper part. Adductor magnus in the lower part. You're understanding? Means in the upper part it's adductor longus, in the lower part it's adductor magnus. I can't draw a three-dimensional slide for you. Look, that's the femur. On the medial side of the femur is what? Vastus medialis. Who are the muscles of the medial compartment? Adductor longus, and if we go down, it's adductor magnus. Okay, they're not in the same plane. Adductor longus is above, adductor magnus is below. But I can't make like that for you, so I've drawn it like that. And the roof is formed by whom? Roof is formed by, what is this? Sartorius. This is the adductor canal. You can imagine this adductor canal. So medially, so above is vastus medialis, below is adductor longus magnus, the roof is formed by sartorius. So this becomes the adductor canal. What are the contents of adductor canal? Contents of adductor canal would be femoral artery, femoral vein, saphenous nerve, nerve 2, vastus medialis, nerve to vastus medialis, posterior division of obturator nerve, posterior division of obturator nerve. So this is adductor canal. Superiorly is vastus medialis, inferior adductor longus above, adductor longus above, and rectus femoris above. This is adductor canal on this side. I have just labeled that. Rufus sartorius. Sartorius. You're following this? Clear to all of you? And contents would be femoral vessels, saphenous nerve, nerve 2, vastus medialis, and posterior division of obturator nerve. Obturator nerve. You're getting this? Adductor canal you're following on the medial side. On the medial side, if this is your body, if this is your thigh, which thigh of yours is this, you tell me. If this is your thigh, you're sitting right in front of me. So which thigh is this of yours? Which thigh is this of yours? Yes, this would be your left. Clear to all of you? So that's about the adductor canal. Yes, that's it. You're right. Yes, this would be your right. Yes. Yes. Right. Clear to all of you? If you look in your own body, no, it will be your left. If you look in your own body, but if you are seeing in opposite, it will be right. That's fine. Nerve in the artery course, I'll tell you. Pelvis is left now. Sciatic nerve, I'll be telling you in the pelvis. Don't worry. Sciatic nerve, I'll be telling you in the pelvis. Don't worry. Femoral vessels, saphenous nerve, nerve to vastus medialis, and the posterior division of obturator nerve. That's it. That's about the diagram. That's a slide. Fine, that's it. You've understood that. No, that's fine. I'll show this somewhere else. You take a break then. You take a lunch break. 3:15 I'll start. 3:15. 3:15. 3:15. 3:15 I'll start. What happened? What do you want? This was a slide. Okay, fine. 320, 315, 320, I'll start. Superior, inferior, same as, and yes. Yes. This is the slide. Okay, you take a lunch break. Thank you. I'll start with histology, general anatomy, pelvis and perineum. That topics we have to finish off. Okay, thank you.